All right. Well, I'm going to call the City of Iowa City Work Session to order for October 7, 2025. And I want to welcome our county supervisors that are here as well. Happy that you all have joined us. Our item number one is a joint meeting with the Johnson County Supervisors about permanent supportive housing. I think I'm going to jump in maybe straight to the shelter house and ask them to come up and do a presentation. So we'll welcome Chrissy Canganelli.
Good afternoon. Let me see if I can pull this up. Not sure how to change the presentation view. Maybe not run it, but not show all the notes. Yeah. Thank you. Thanks, Tracy. Thank you, everyone, for this opportunity to present to you and to have this conversation about permanent supportive housing and the work that we've been doing to build capacity for this housing intervention. This afternoon, we're joined by our colleagues from the Corporation for Supportive Housing. They will be doing a fair amount, the heavy lifting of this presentation. Amy Stetzel with CSH is here in the room, and then Gabe Schuster is joining virtually. So with that, I'm just going to turn this over to Amy. Thank you.
Great. Welcome, Amy.
Hi, thank you. Hi, everybody. My name is Amy Stetzel. I'm the Upper Midwest Director for the Corporation for Supportive Housing. And Upper Midwest means I get to work with folks in North and South Dakota, Iowa, Wisconsin, and Minnesota on a whole host of things related to increasing housing stability for the residents of those states. So we'll talk a little bit more about what CSH is, what we do in the upcoming slides, but just wanted to give you kind of a little bit of a lens of what my role is. So today we're going to be talking about what is supportive housing, how does it operate, what is the need for permanent supportive housing here in Iowa City, what the data shows us, and what more do we need and what do we need to protect. And then we're going to be talking about some next steps in some community planning processes over the next handful of months. So CSH, we're a national nonprofit. We're headquartered in New York, but we've got regional offices across the nation. And we've been here in the Midwest, gosh, for 25 plus years. So we have a really strong presence here, but really we work to advance affordable housing aligned with services. At the core of it all, permanent supportive housing is deeply affordable housing connected to deep end services for folks. And really historically, permanent supportive housing came out of meeting the needs of folks who are chronically homeless, so have really complex health and behavioral health issues, and has over the years, we also work with folks who have IDD or are child welfare involved, but at the crux of it all, still have those complex health needs. So CSH, we do a lot of different kinds of things. We do TA and training, we do policy work, we do systems change. We're also a CDFI, so we're a nonprofit bank, so we also do loans and things like that for communities. And of course, our focus is in the name. We're focused on housing, but we're also focused on economic security is a key piece of that, and then the services, which are really the secret sauce to permanent supportive housing. So really quickly, here in Iowa, we were able, gosh, a handful of years ago now, Chrissy, to collaborate on a FUSE initiative that led to Cross Park Place. This was before I was at CSH. We worked with folks across the state of Iowa to create definitions and standards for permanent supportive housing. We'll talk about those in a second. We've been working with partners on the ground to push back against the criminalization bills that have been coming forward. And we also just finished a supportive housing academy or institute, which was a 5-month-long training series with 7 teams across the state of Iowa, all about let's take your dream of what you want housing to look like in your community and turn it into a reality. So I just want to give a shout out here to my colleagues here in Iowa City that are part of the Iowa Center for Excellence in Behavioral Health. They led a year and a half long piece of work that was around how do we define permanent supportive housing here in Iowa? How do we measure quality? And Chrissy and I were part of that work group. I know Shelter House was seen as somebody who was seen as a best practice in permanent supportive housing, knowledge expert at that table. They were called to be a part of that. And we came up with this definition of permanent supportive housing. And so I am just gonna, I usually don't read slides. I hate it when people do that, but I am going to do that here because I think it is really important. So PSH, permanent supportive housing, is an evidence-based, minimal barrier housing intervention prioritized for individuals with those complex, multi-occurring conditions that meet fidelity to the established standards that this group also set. Individuals in PSH live with affordability, autonomy, and dignity through the combination of person-centered, flexible, voluntary support services and have a legal right to remain in their housing as defined by the terms of a standard renewable lease. Access to and maintenance of housing is available to individuals who meet this eligibility criteria and is not based on housing readiness requirements such as sobriety, behavioral, or program compliance. So quickly, what you heard what supportive housing is. So what permanent supportive housing is not is a treatment model or method. It's not time limited, and it's not a group home or some other kind of licensed care facility. And actually, well, they'll come up later, but I want to say too quickly, the Center for Excellence in Behavioral Health also did this incredible amount of work setting up standards that folks in Iowa who run permanent supportive housing can go and like measure their programs against. Unfortunately, their contract with HHS didn't get renewed for that, but all of that information is still on the website. So still accessible, trainings are still there to review, but want to give them a lot of kudos because they did a ton of work and are excellent at what they do. So there's two different ways we can do permanent supportive housing. You can do it as a single site. That's one big building, right? Where you've got maybe 20, 30, 40 tenants or rooms in a building. You also can do scattered sites. So what we see often in communities is organizations will buy single-family homes, and then you can rent those to folks and have the services come to them and wrap around them in the home. So for development purposes, that can be new development. You can brand new construction, right? Or you can acquire a property and rehab it. Or we often hear about something called master leasing, and we have a handful of organizations that do that. Sometimes they are doing that in partnership with landlords where they say, we will take over the lease. Like, this is still your building, you still own it, but we'll take over the lease and kind of run all of the legwork with the people who live here, make sure everything is up to snuff, and do all the lease pieces of it, but you still own it. Otherwise, we also see organizations who actually buy the housing and then they become the leasing agent. So what is permanent supportive housing? So this stool, it's so hokey, but we use it all the time. We talk about this four-legged stool. And those four legs, the key ones really are housing, property management, and housing management or asset management and support services. But then the fourth leg that I think is just as critical is the project's relationship to a community. How does it work in a community? How is it integrated? And so again, you can see the model here, but permanent supportive housing is that deeply affordable housing with all these services around it, whether that's employment services, it could be primary health services, it could be mental health, substance use, parenting, life skills, and then basic good case management comes with that as well. The relationship piece is really key in supportive housing. These are those quality standards that our friends at the Iowa Center of Excellence for Behavioral Health put together. I'm not going to read through all these, but what I will read through is the 5 yellow circles, which are the core pillars. So again, minimal barrier, you heard this in the definition, minimal barrier, voluntary, affordable, integrated, and folks have informed choice. So what we find across the nation, across many studies, across longitudinal studies, is that supportive housing works when it's done according to the model. Tenants stay housed. Tenants have social and community connections. Tenants increase their income and employment. All these positive outcomes we see that we want for people in our communities, we see with supportive housing. And we also see that it ends chronic homelessness, it ends homelessness. It's been proven to do so over and over again. So what I stole this, I will say, this slide, it's got a lot in it, but what I love about it, I stole it from my friends at Minnesota Housing Partnership. And I made it Iowa specific. Because what I love about this is it shows where permanent supportive housing falls in a housing continuum. All of you are constantly thinking about the full housing continuum in Iowa City and Johnson County. And how do you have every piece of what you need to make that housing continuum hum and work for the people in your community? And so what I like about where this shows is sometimes, I know I do this, but sometimes we talk about these interventions as if they're their own thing. They fit into a puzzle piece that's bigger, right? And so you'll see here, permanent supportive housing is for our lowest income, the two buckets to the left of the leftmost side of this chart, along with, you can see emergency shelter. There's also rental assistance. That red bar goes across the whole way. But permanent supportive housing goes all the way up there to then it starts to butt into community land trust work, or when it gets a little bit into it's not high income, but it's higher income than the extremely low income, right? Home ownership assistance. And then the further you go, it's more kind of the more average rental market of what folks are experiencing in a community. So these numbers are for Iowa. And then my friends at Shelter House pulled together specific to Johnson County, the same slide, so you can see that in front of you as well. And the numbers, I think specifically the population bucket there, you can see the numbers of households from Johnson County that fit into each of those, which is really nice to see. And with that data piece, I'm going to hand it over to Gabe. And Gabe,
Thanks, Amy. Can folks in the room hear me?
Yeah,
Yes.
we totally can.
Welcome.
All right, great. We can go to the next slide, please. So first of all, my name is Gabe Schuster. I'm a senior program manager at CSH on our data and analytics team, which is a small team situated within a slightly bigger national team called Strategy and External Affairs. What that really means is that I get to work all over the country on projects where data plays a particularly important role. And a lot of my portfolio relates to work that we call needs assessments. I head up the national needs assessment work that we do at CSH, so thinking about the extent of supportive housing need nationwide. And then also do a lot of work sort of translating that methodology down to the local level, where we do strategic planning with communities around the need for supportive housing based on local data rather than what is necessarily accessible on the federal or state by state level. And so when we're doing that strategic planning, we talk often about reaching functional zero, or solving homelessness in terms of reaching functional zero. And this really has three main parameters, and we describe that as when the experience of homelessness is brief, rare, and non-recurring. It means that we can preempt homelessness wherever possible. That might be through programs like prevention, but also through more holistic processes like improving housing stability and affordability across the board. Brief in that when a household does fall into homelessness, they're quickly met with the resources they need to retain housing or reattain housing. And non-recurring in that once a homeless household is housed, they stay housed. And one important piece here is that it's an ongoing process. It involves with the community. It's not a one and done, like mission accomplished type of situation. We need to always be addressing the needs in the community to maintain functional zero. Go to the next slide. So our needs assessment work. We broadly are thinking about three main things that feed into our needs assessment. We look at data from different systems that work with households or individuals with needs consistent with supportive housing. We compare that with a lot of research, both on the national level and local data through community feedback around the rates of need. So, for chronically homeless individuals in the community, what share of those individuals do we think have needs consistent with supportive housing, and so on? And then lastly, the sort of final step is thinking about costs. So once we look at that model, we think about everything that's going on in the community. We then also want to do some financial modeling and projections around what it would cost to bring those units to bear, and then also to sustain them in terms of ongoing operating and service costs. So in Johnson County and Iowa City, we're taking the same approach at the local level. We're looking at the need for permanent supportive housing across a number of different sectors, but with data really relying on homeless system data from the Homeless Management Information System, or HMIS, which allows us to look at very detailed data about who is experiencing homelessness and some of the characteristics of those households. But when we look at that data, we really want to ground it in the community experience. So we have been holding a number of sessions with various stakeholders and organizations that deal with things like behavioral health, physical health, the criminal justice system, and so on, to think about what they see in terms of the clients that they interact with, and how that can help us refine our estimates around the need for supportive housing locally. And then there are three primary data types that we think about. So we look at how many people are in those systems. We look at, in this case, really the chronic and non-chronic homeless adult individuals. We also think about homeless family households, and then homeless transition-aged youth who probably have slightly different service needs than adult individuals. And then we look at those rates of need. So what do we think, what share of those populations have needs consistent with supportive housing? That gets combined with data that we have around the inventory locally. So what housing exists today and how it's functioning. Things like utilization rates, turnover time, to see if, before we calculate out a final gap number, is there a capacity to functionally expand the supportive housing provided by the system through things like improving efficiencies at the local level. And then what we're left with after that process is, the gap, what more supportive housing is called for. You can go to the next slide. So on that front, the state of PSH inventory in Johnson County is that it's operating at a really powerful clip. What we see is around 90% utilization by the permanent supportive housing that is administered by Shelter House. And this is pretty much a functional maximum. So people will see that and say, well, there's 10% to be gained there in terms of hitting 100% utilization. We don't really ever see 100% utilization because there is always going to be some downtime in units when a tenant moves out. It can take time to match a new tenant into that unit. There may be need to do repairs or updates to a unit, same as when anyone moves out of their apartment. Nationally, we see that utilization for PSH is a bit lower than what it is in Johnson County. It's around 84% as a national average. The only standout piece to that locally is the Veteran Supportive Housing BASH program in Johnson County operates at about 55% of utilization. But of course, this is a system that is limited in terms of the population it can serve. So they have, I think, is around 90-something units, but they can only serve veterans. So the remainder of those units are, expected to be a bit more underutilized. Next slide. All right. So locally, we've been leveraging 3 years worth of data from HMIS, the Homeless Management Information System. Johnson County is part of the balance of state for Iowa Continuum of Care, so it gets lumped in with a lot of other places, but we've been able to work with HMIS to get Johnson County specific data. So they were able to pull for us data on the populations and households served in emergency shelters, transitional housing, prevention, street outreach, over the past 3 years. And these are unduplicated households. So we make sure that when households, maybe touch a system, they move back out and then experience homelessness again, that we're not double counting those. And what we see there is, not too far off from national standards. About 23% of those households experience chronic homelessness nationally and statewide. That is 22%. So just very, very slightly, really insignificantly over what we see as a national average and an average in Iowa more broadly. And it's worth calling out, however, that this is really a lower bound of people who experience homelessness, because this is just the folks who have contact with the system. So, of course, if people aren't enrolled in any of those programs, aren't entered into HMIS, they are missed. Of those households, 1,093 households, 77% were adult-only individual households, 14% family households, 7% were transition-aged youth, and 1% of those were parenting youth. So family households where the head of household is between 18 and 24 years old. So, as I said earlier, we do a lot of stakeholder sessions as part of this process to think about what we see in the data and also to help us refine our estimates around the share of those populations that have needs consistent with supportive housing. So in these sessions, we look at preliminary numbers that are coming out of the model, discuss the total need that we're seeing. We break that out by household type and intervention. We also conduct a number of interviews around how the system functions to determine if there's room for more efficiency, to leverage resources differently, and really think through what are the local challenges and local development paradigms, because ultimately the result of this work isn't just to put out a number and say this is how much supportive housing is needed, but to pair that number with recommendations for how to reach that. So the number itself is really maybe 50%, probably less than the total result of the work. How do we get there, those recommendations that come through a lot of qualitative data, a lot of conversations with the community is a big bulk of this process. So that said, the preliminary findings that we see in the model sits around a need for just about 300 units of supportive housing. The first steps that we take in our modeling are to look at rates of need from our national needs assessment for those same populations, and then do some adjusting based on the community input and feedback that we have. So those tweak the rate of need estimates that we feed into the model. And then we do account for annual unit turnover and potential for any system efficiency improvements. So annual unit turnover, how many units currently do we expect to come online over the course of the year through natural turnover? And then if there is room to serve more folks with the existing inventory, which, as I touched on, we're pretty much operating at maximum capacity. Of those 300 units, we're seeing that about 260 or so would be for individual adult households, and about 40 would be for families.
I had a question about this 261 units and the 36 units for families versus individuals. Is this specific to our community?
Yes, it is.
Okay. And Johnson County totally, not just Iowa City?
That's correct.
All right, thank you.
And I think with that, I'm going to pass it over to Chrissy.
Thanks, Gabe. So, in part, I just want to predicate the next portion of the conversation with the reality that this is the projected need to right-size permanent supportive housing for Johnson County. This is predicated on the existing capacity that we've been working to maintain, which is 61 bedroom units across 2 different single-site projects and 130 units of housing supportive services through scattered site and using specialized vouchers. We thought that it'd be helpful to look at the costs that have been associated in developing permanent supportive housing in our community and looking specifically at the most recent project that we worked on and opened in 2022, the 501 project. I'm known for utilitarian naming of projects. So the 501 project, it's a three-story building, over 24,000 square feet, new construction project. We broke ground in the spring of 2021. It was placed into service in June of 2022 and fully occupied by the end of August. It was a very aggressive construction timeline. We have our general contractor there to thank for that. The building is built to trauma-informed design specifications, just like Cross Park Place was. It is 36 one-bedroom units, includes offices for program staff, private meeting rooms, clinic area for our embedded primary and behavioral health clinicians from University of Iowa Hospitals and Clinics and the College of Nursing. There's laundry, computer workstations, multi-purpose congregate areas, and very importantly, a hot room for bed bug mitigation. That project, from land all the way through construction completion, in 2022 cost $7.57 million. To source that project, we used multiple funding sources, and you can see that on the right side of the slide. National Housing Trust Fund, which the Iowa Finance Authority administers. It's a conditional loan, so not repayable debt, thankfully. Housing Trust Fund of Johnson County, with the support of everyone in this room. We have both a grant and repayable loans, so we are supporting debt service through that support. And CDBG home grants, private giving, and commercial financing. I'd say going through this experience, I would never advocate for doing commercial financing for a permanent supportive housing project again. We were responding to a great sense of urgency and need to build capacity and create additional permanent supportive housing units. Following our experience with Cross Park Place, we saw the transformative impact that we were having, the life-saving impact that we were having, and we did all that we could to bring these 36 units online as quickly as possible. Thankfully, the East Central region, which of course no longer exists, was very significant in helping us. They played a significant role in helping us to be able to pay off and retire that debt, in addition to quite a number of local private donors. Working with our general contractor on this project, just recently looking at the numbers, I asked what would it cost to build this same project if we were to go forward in 2026. And he estimated, if it was the same site, the same land, everything staying the same, $10.2 million for 36 units. So significant increase in our development costs there. An additional component to bringing permanent supportive housing online has been the reality that we fully furnished the units. So we had a budget for 501 of $475,000. That was furniture for all the units, the common spaces, work areas, clinical spaces, the technology in the building, safety requirements, and that was sourced through a grant from the Johnson County, private gifts, and then grants from civic organizations, private foundations, and corporations. The part that we really want to lean into and make sure that we're not missing here is to ensure that folks understand that the significant ongoing costs of permanent supportive housing. So the building is one thing, bringing that building online is one thing, and building it for the intended purpose and to last, but then it gets into the reality of the annual operating and supportive services budgets and how to source that. So for operations, we're looking at single-site permanent supportive housing facilities. Those facilities are staffed 24/7. For Iowa City, that's a code requirement. I think it's still a code requirement. Even if it wasn't, I would require that if we were bringing a building online, it it should be staffed 24/7. That's really a protection for our tenants. It has been very important, not something to be missed there. You also need to be looking at property management and facility maintenance. The buildings, the units get a lot of wear and tear, heavy wear and tear. So these are significant expenditures for a permanent supportive housing provider. Supportive services, just generally, the case manager to tenant ratio, best practice is 1:12. We maintain that 1:12 ratio. We rely on deep partnerships, longstanding partnerships with University of Iowa Hospitals and Clinics Adult Psychiatry and University of Iowa College of Nursing to provide both the behavioral health and primary health care services embedded in our buildings. That's at no cost to our tenants. We're not paying for that. They've been able to figure out how to source and resource that work. And it is a key part of ensuring that we have a high fidelity program. So when looking at the costs, those annual operating costs, trying to break it out in ways to wrap my head around, I looked at the average per tenant cost at 501. So the average per tenant cost, annual cost, is $23,120. And that's for a project if I remove any debt service out of that. So if we don't include debt service as part of our operating costs, that's at 23,000 point. That pencils out to a little over $830,000 annually for the operating and supportive services budget to support 36 tenants in a 36 one-bedroom unit multifamily building. To source that, we've relied on a combination of different resources. Project-based vouchers. The partnership with the Iowa City Housing Authority has been vital to our community's ability to bring permanent supportive housing online. We would not be able to do this. The fact that they were standing by us from the very beginning of these initiatives and removed local restrictions so that only those federal restrictions applied meant that people who had been homeless for decades now could qualify for that rental support and access housing. So it really has, they are a core partner and stakeholder. Then that in combination with tenant rent. So tenants they are responsible for paying up to 30% of their income. And then the other components, we rely right now on HUD Continuum of Care funding for the supportive services and operating portions of our budget, and private gifts and fundraising to cover the gaps. I will say that going forward, if I had the ability to just draw a dotted line through that HUD Continuum of Care for you right now, I would, or a red X. All indications are that changes in HUD policy and practice will no longer support this work. So that, I'll get to that in a second, but that's a major challenge. But on the good news side of this, and most importantly, is the impact that we've seen in our community from permanent supportive housing. Permanent supportive housing works. It is transformative. It delivers. On the left side, you see the national outcomes, those indications of changes in public systems. So incarceration rates decreasing by 52%, more than 83% remaining housed for at least 1 year, emergency room visits declining by 57%, and emergency detox services declining by 87%. Locally, we do not have all of, at least currently, all of the data analysis methods of being able to collect and update this data consistently. We would love to build that capacity, but what we do have are some data points that we can share with you tonight. And in every way, we are exceeding those national trends. So working with Iowa City Police Department, we were able to analyze the last 2 years, or the 2 years prior to housing for Cross Park Place tenants, their arrest records compared to the most recent 2 years in housing, and that's a change of 68% decrease. When we first looked at tenants at Cross Park Place after opening in 2019, by 1 year in, when the city had more data analysis capabilities through grant funding, we worked with Iowa City PD at the time, and the change in incarceration rates was a decrease of 73%. So we're holding steady in these areas. And 98.8, almost 99% of our tenants are remaining housed for at least 1 year. Another part of this housing stability metric is the fact that for our single site projects, out of the 60 units, since January of 2019, we've housed 93 individuals in our single site projects. Only one person in that entire time has exited to homelessness. So to say that permanent supportive housing delivers is an understatement. It is an intervention that ends homelessness. It has broad public cross-system benefits, and it transforms lives. It saves lives. We do have just a couple of case studies that we could look at on the changes in medical services and hospitalization utilization. These are dated. Again, we'd love the capacity and the data sharing relationships to be able to continuously have this information. You can see on the left-hand side, tenant 1, prior to housing, significant medical costs being incurred, over $200,000. About 1 year into housing, that decreasing to $957. That's a change of 99%. Tenant 2, similar, change of 74%, and specifically across the two individuals, a 78% decrease in emergency room visits. So whereas these indicators, these metrics have profound implications for our partners, for the different systems, I wish that there was a way to really bring this home for you as to what it makes, the difference it makes in the actual person's life, and the people who we're working with, and their quality of life, and how dramatically it changes over what is a really relatively short period of time. Also say one of the foundations of permanent supportive housing is that engagement is voluntary. Sometimes people want to kind of pick away at that. 100% of our tenants over time, as they build rapport with our staff, with our partners, 100% are engaging in some aspects of ongoing care and service. And it's their choice, which is profoundly different than what they're used to. So the challenges. There's quite a number of challenges. Again, predicating this on, we have 60 units in single site of permanent supportive housing is our current capacity, 130 through scattered site. The reality of the housing market in Johnson County does not really lend itself very well to development through scattered site. We have an inelastic housing market and a high tolerance for vacancy rates. Development timelines, they're timelines, they're not immediate, versus the imminent need and the sense of urgency that I know that we're all feeling here in our community. It compels us to consider intermediary interventions, but how to balance those interventions without compromising the long-term goal and solution to ending homelessness. Another reality, we have near-term funding cliffs, COVID response dollars, Home ARP, Home ARP, and SLFRF. Those funds are currently being used to support 105 households. They're receiving supportive services through scattered site, utilizing specialized vouchers. That funding ends by December of 2027. We have imminent changes in HUD priorities and practices. If advanced, that will place 84 formerly chronically homeless individuals at very high risk of losing their housing. We will not have the resources to continue to maintain their housing and support services. So specific timelines, as soon as July of 2026, if these policy changes are enacted, we, as a community, lose $515,000 that is being used to support 60 permanent supportive housing households, and by January of 2027, another 265,000 that is supporting another 24 households. To kind of tie things back to the process that we've been working through and partnering with Corporation for Supportive Housing and our stakeholders community-wide, the needs assessment and the community planning, we're deep into this process. Some of the initial data has been shared with you. So we are now into the community planning, broadening out those conversations that October through December quarter, looking towards the first quarter of 2026 with having some initial documents and materials, recommendations ready to share out with the community, and facilitated conversations to start considering and reviewing what the different investment strategies might be based on the policy interests that all of you have. And that, I think, ties out our presentation, and I'm very happy to take any questions that you have, and I'm sure Amy will, and Gabe as well, be available.
I have just a very localized question. It's the second to last slide where you talk about the challenges. What was the, actually, there we go. Thank you. It was the 2027 amount.
And we can send this out.
That would be fantastic.
I just have a question. When the CSH member was talking about the data shows that 1,093 individuals engaging with our homeless system last year, but the recommendation is to create only 261 for individual and 36 family for Berman supported unit. Can you clarify how the recommendation was calculated? Specifically, how many of the 1,093 people were identified as chronically homeless or likely to need long-term supportive housing versus those who only need short-term support?
Gabe, would you be able to respond to that?
I am happy to. Can folks hear me?
Yes.
Great. So that is correct. 1,093 individual households had contact with the homeless system in 2024. And our estimates right now sit around 300 units of supportive housing need tied to those households. We don't estimate that, every household that experiences homelessness has a need consistent with supportive housing because there are going to be other interventions that work for those households to help them reattain housing that don't necessarily come with the same intensity of services or sort of permanent supports that really define the permanent supportive housing model. So of those, households that we saw, 220 of the 1,093 were chronically homeless individuals. And about 626 were non-chronically homeless individuals. On top, we don't estimate that 100% of chronically homeless individuals have needs consistent with supportive housing either. Right now, the model puts the estimate of need in that population around 90%. And we do also have some estimate around need for non-chronically homeless individuals or households because sometimes the assessment criteria miss where there might be sort of deeper service needs.
Mm-hmm. Thank you.
Thank you very much. That was a wonderful presentation, everybody. I was curious.
Will you get closer to your mic, please?
Sorry about that. I saw that the scatter site, or excuse me, the single site, like 501 and Cross Park Place, et cetera, had a higher success rate. Is there something? Is that like consistent data, or is that just kind of like what we see in Iowa City?
Well, for success in housing stability, scattered site versus single site.
Yeah.
We could
No,
talk about the
thank you.
local, but
That's a great question. I will say the success that Shelter House is seeing is phenomenal. And nationally, we do see a high, we usually, Gabe, what would you say? I feel like it's in the late, like 80%, early 90% of folks who stay housed for at least a year across the nation. It's just the data that, and we can send you links to all of this data as well, but the data that we see over and over again just shows, like Chrissy says, it works. It works. It works. People just stay housed.
Is there something to the fact that I mean, I know that a great deal of thought went into the design
Yep.
of both of those buildings. I would assume that has some positive impact.
Single site versus scattered site, why is there a national difference in success?
Yeah.
Is the question.
Is that, the question is between single site and scattered site, or with a trauma-informed design?
Yeah,
that was
I
his
think that's what I was
question.
asking. If there's
Okay.
a national trend of the single site versus scatter site success.
Oh, sure. Gabe, do you have that information handy at all? And we can definitely circle back with you and see what the difference is there with that, for sure.
I will say that locally, our experience has been that when we are in scattered site, individuals, the households have multiple neighbors that are not, they haven't had the same lived experience. They don't have the same invested interest in helping people remain housed. We're working with landlords that do not have the same mission as we do. So these kinds of differences do have an impact over time, and primarily we see non-renewal of leases.
Okay.
Somewhat related to that, what is the, I guess, right proportion or right size of these I'll call them a multifamily unit, but multiple, like the 501 project? I mean,
Sure.
36 is obviously works for what you're doing now, but is it more efficient to have more, or do we run into more problems when the units get larger, or do you have a sensibility both what works here and maybe what other communities are doing that works best?
Yep, and I'd invite Amy in a sec. I can respond, and if you want to add anything too. So right now, our experience would definitely be that 24 units is not efficient from a cash position. 36 units gets us much closer as long as we have the project-based vouchers and we're maintaining utilization of the units, occupancy. A higher number of units would probably get us closer to cash flowing, and we'd want to look at, if we cannot count on sources like HUD Continuum of Care, what is the right size from a cash position to be able to cash flow the operations and supportive services? But then at what point do you have too high of a concentration of individuals? And then can you design around that to create space and place for folks that you don't have the impression of too many people? So on a high end, we've worked with partners in Mecklenburg County in North Carolina. They have over 200 units, I think, in one location, and they've figured out how to make that work. When I say that number to my team, they just kind of look at me like, what? But Amy, do you have anything to add?
No, I think what Chrissy really raises is a key piece of this, is that you have to really be mindful of math, of how to make the cash flow work. And so that's a critical piece of it from an operating standpoint to if your building is LIHTC as well. But then the other piece of it is the higher you get, the more folks you have who have high complex needs that are concentrated. That also means you need to have a lot more staff. And so we've seen big projects that have worked really well because they had the staffing to do it well, to do the program to fidelity. I've also seen supportive housing projects that were, say, 50 really high need child welfare involved families, and they did not have the staffing structure, and it wasn't good. And so there were lots of complications with that. So there's cash flow questions that come into play. There's staffing and operations questions that come into play there as well to kind of figure out what that magic number is.
I have a question for you. Since you're working with, PSHs all across the nation, what are some of because we know HUD funding is at risk, and the philosophy behind it is not right, because we're seeing the results as you all have shown. What are other funding sources that folks are utilizing? Are there any through other federal, outside of HUD, or HHSs. I know that our ECR is no longer and not sure what the new funders will do, but are there other opportunities for funding?
Yeah, thank you for that question. I think we are figuring that out in real time, I think, and looking into that deeply at CSH as well, because the reality is those COC funds across the United States, the average percentage of continuum of care funds, what communities use that on is permanent supportive housing, and what they want to do is cap it at 30%, which would just decimate supportive housing across the nation, as you all know. So I will say that we have states who've passed sales tax. That's just targeted, that's state dollars targeted for housing. Or they've created state housing vouchers that are not connected to federal rules. We see some things like that, I think, leaning into Housing Trust Fund. I will say, here in Iowa, and others can speak to this much more eloquently, but with the new change with the behavioral health system, it's really fascinating. I was at the Iowa Housing Conference, and the person who was speaking was like, you know, of all the 2,000 calls we've got since just the start of this in July, the number 3 thing we're asked for is housing. And so my hope is that they really hear that and take it to heart and start realizing that they need to be investing, using Medicaid dollars to help pay for housing, housing navigation, models like that we see across the nation that work. But those are I think those are some of the pieces I've seen states lean into is essentially it's state dollars that have been passed.
The services part, we're very fortunate that the University of Iowa Psychiatry as well as the nursing school is contributing or is a part of the process. So that was great to see. Again, when I think about the services part, I was at your, or at the presentation last year. Mayor Pro Tem and I was there in Des Moines, where CSH shared about HHS and how some of that more providers are needing to partner with HHS to fill in the gap or to provide some of the services components if folks are eligible. Can you speak to that a little bit?
When you say is that the Housing Stabilization Services program?
No, Health and Human Services.
Yes.
Yes.
Okay.
I'm assuming, I have notes, I can find it
Okay.
from there.
I'm not recalling that. Do you want to speak to that real quick?
Yes.
Sorry.
I just say that recently, leadership from HHS was in Johnson County, and both really within the most recent Housing Iowa conference and within the meeting that they attended here in Johnson County, and conversations with leadership at Iowa Finance Authority, the message is clear. It's not for HHS to figure out. All sites should be turned to Iowa Finance Authority. They abandoned the Center of Excellence in Behavioral Health and advancing the standards for permanent supportive housing and walked away from permanent supportive housing. So I would say that's the current temperature and intent with a lot of very political ease sandwiching around both sides.
Great, thank you.
I have a question about the vets. You indicated that some of the housing that is specifically for vets is underutilized, and we're looking at a project here coming up that suggested that that's a gap that we need to fill, is the vets who need housing. So is the discrepancy because of staffing capacity, or is it something else?
I don't want to speak for the Housing Authority, but Tracy, keep me honest. If the Housing Authority has worked very aggressively to bring the VA Healthcare Center and the resources that they have, the supportive services part of that, to support the VASH vouchers, the vet-specific vouchers, along. A couple of years ago, we were awarded case management for veterans needing permanent supportive housing, and we were able to significantly increase the utilization rate at that time, working closely with the Housing Authority. But we have time-sensitive limits on how long we can support veterans. That needs to then transfer over to the VA, and I believe that the initiative here to establish units and dedicate those for those VASH voucher holders is to try to bridge that gap and that tension point that we're seeing with our federal partner.
Thank you.
Go ahead.
I just want to go back to the assessment again. Does the assessment include data on language access and culture barrier faced by immigrants' family when trying to access existing housing or shelter? Because we see many families struggle long-term due to the systemic barriers like language, credit, immigration status that keep them out from both housing and data. I would love to understand that better. Do you assist that?
Gabe, did you hear that question? Gabe still with us?
Yep. What I understood, if someone could just reiterate, what I heard was a question around whether or not sort of culturally relevant practices were a limiting factor in access to the supportive housing and system efficiencies.
Yes.
Yes.
Yep, you got it.
Great. It is not something that has cropped up in the conversations we've had thus far. That said, it's something that has cropped up in pretty much every community that I have worked with. So it is something that I think is really consistently in the recommendations that we put forward, but the particularities of what those recommendations will look like for Iowa City, I think will really be fleshed out in like the next phase of stakeholder conversations that we're going to be having. And I would say that we are really open to any resources around community groups that might, want to participate in those conversations as well, beyond just the providers and sort of system level players that we've been talking to.
Sure.
Yep, and I would just add to that, I think that's where this data is this great jumping off point, where then we add a lot more of the contextual nuance and color to what really needs to happen on the ground, and definitely pieces like that.
Sure, of course. Yeah, I just want to highlight that in many cultures, homelessness does not always look like sleeping outside. Yep. It looks like families living in overcrowded apartment or rotated between friends and families, or like sleeping in another area that could be like an office where is not typically will be count on the outreach, street outreach and all this. And also even like evaluating them by the current, homelessness system, even when we want to recommend them to supporting housing, whether it's like refugee housing or anything else, many times they are not scoring high because the trauma that they're going through is never been like the people in the U.S. who suffer from that, they have a specific thing that the system built to calculate that. But for the immigrants, they have their own issue, but the system never created with immigrant center. That's why most likely we see them don't score high so they can get the benefit of the refugee housing or the eviction preventions.
Yes, yeah, thank you for raising that. We had a county in Minnesota, Ramsey County, who took some of that into account as far as just trauma history and historical genocide, things like that, to take into account to have the score be higher for folks who do reach that system. Because I totally hear what you're saying. And that's something we can definitely work through and speak to as well.
Sure. Thanks.
Can you please repeat where that was?
Ramsey County, Minnesota, St. Paul. Yep.
I just wanted to return to the financial question earlier. I think we know that, we're pretty much on our own. I don't think the state or the federal government is coming to help us.
Right.
And if I was kind of doing the math correctly, at the 36 units and not being 8 million, but now up to 10 million, it's, closer to like 86 million just for newly built construction if we were to try and hit the 300. That's very napkin kind of math, because obviously family versus single family, that kind of thing. But just speaking to like $100 million, I guess, venture, have you thought about like where and how that could look? I mean, we have, the whole county and city representation here in Iowa City. It doesn't really bear out in the data that we're being presented today in terms of if we're looking across the county, it's obviously beyond just Iowa City, but a lot of our services are here. Have you gotten to that point at all, and what that could look like?
You mean as how to source it, where to place it?
Where to place it, and I think to source it, that's going to be a really big question. But if we were just looking at how are we going to take care of ourselves?
Yeah. Well, if we were to do something, and again, a lot can be done through design and creating space and place. Is this a campus kind of an initiative that we would be looking at least for single adults in combination with some very intensive medical supports? There are some models across the country. Specifically, Denver has a model with a combination of permanent supportive housing units and like medical respite beds in the same building, and the hospitals contribute to that because of the offsetting decrease in expenses that they're able to realize. I think that there's a lot to be discussed as a collaborative, as a community, across stakeholders, and some opportunities for something really innovative. And then even getting into the, so there's the ticket price, which is very substantial for the built, but the ongoing operations and supportive services, different investment strategies that have been employed across the country, pay for success models, social innovation bond, social impact bond, different ways of financing this work that achieves the outcomes that we're looking for.
That's a good segue to a question I was having. Can you go to the case study slides?
Sure.
I think it's easy to say permanent supportive housing is something like everyone up here is interested in. It's just the how, where, and how do we pay for it questions that are the big questions. And what does it look like? Yeah, that one right there. And thinking about this math here, realizing that there's a really important stakeholder who's a financial beneficiary who's not here.
I think you took the question right out of my mouth, so
Yeah,
go
so
for it.
Can you speak to that about, I mean, our local emergency rooms are sure saving a lot of money. What's their engagement?
So they're not saving money. They're just not spending their resources on these people, right? The emergency room's still open.
Sure.
There's a substantial, profound benefit. And I because we've been.
You're being nicer.
Well, we've received that feedback before.
They're not
I want to make sure.
Yeah, they're no longer writing off 90% of their.
And we do have another data point where unreimbursed medical costs after a year in Cross Park went from $1 million down to 16. That has value. We've not been successful in being able to translate that value into a more robust investment, right? But we're very grateful for the investment that we do have with these champions that are providing these clinical services, and we need to protect that.
Yes.
But UIHC is a key partner. They're a key pull factor for our community that informs the demand and need for this housing intervention that is targeted for individuals with complex health needs. So how to bring them into the conversation and engage and be a part more robustly of the financial solution to sustaining this work, there's a benefit to their overall operations, right? Because these folks that, years ago when we started talking about permanent supportive housing, we were identifying these individuals, these frequent system utilizers. It's a very bad term, but, they were 10% of the population that were requiring 90% of the care and the investment. And when we remove those individuals from these emergency type healthcare and carceral system responses, what does that do overall for the benefit of the community, let alone the benefit of the individual? I don't know if I'm answering your question, Josh, but.
The conversation that I wanted to hear started.
Yeah.
But I will say to you, and I was going to say this to the mayor's comment as well, but there is a host of communities that are working with their hospitals. Hospitals are providing flex service funds that service providers can dip into to provide these critical services to keep folks who are high utilizers, folks who are high cost, folks who are uninsured, to keep them housed, keep them stable, keep them going to, their doctor's appointments, keeping them on the behavioral health that they need, right? And so there's definitely multiple models out there and examples we can share with all of you of communities that have done this.
Be helpful, thank you.
Yep. I want to add as well, our work to investigate, explore data sharing capability and appetites across our community, across sectors. UIHC is very invested and key in that work, and I see that capability if we're able to develop that over the next couple of years, and those partnerships as being very instrumental to building that investment and that partnership more.
Can I hop in on that? Given that the Center for Excellence in Behavioral Sciences has been closed, is that a place where UIHC could help fill that gap in terms of being able to do that type of research and helping sustain those standards and continue that data?
So they haven't been closed. Just the portion of the contract that was supporting permanent supportive housing was ended.
Okay, thank you for the
Walked
correction.
away
Yeah.
from.
It was a little too general.
Yeah, no, I just wanted to make
yeah,
sure.
no, I'm glad you did.
I don't know what the role of UIHC could be in supporting that work. It seems like a natural partnership.
Yeah. And then I have one question, actually. One of the pieces that you mentioned about different models is master leasing. And you talked about it a little bit, and it immediately went to my mind as the challenges that could be with that. But I was thinking also about, what if there's larger properties, right, that could be renoed or that are there that could actually create like a campus model or what have you. Is that something that has been in the conversation, number one? And then number two, in terms of thinking about sort of what's the win-win for those types of partnerships, how do you make that attractive to somebody who owns the property? What do they get from this? Do they get a tax write-off? Are they able to? How can we think about these partnerships creatively? Because I do see that it probably is, I would imagine that master leasing, if it's on individual properties, as much as it actually fits with our strategic plan about affordable housing and helpful housing across the spectrum embedded in neighborhoods, the need is so great that it seems also that it would be more cost effective to think of a larger property and be more creative about it. So I just wondered if that's something that has come up. And if you could speak to, just talk about that.
Master leasing in general.
Yeah,
Yeah.
thank you.
I think it's a really fascinating model because I think what it does is it keeps, the thing with supportive housing is that they're not only excellent service providers, they're incredible property managers. And so you're doing this dance of walking with a tenant and being with them in the moment of, okay, you're going through the hardest time of your life, essentially. Yet at the end of the day, you still need to pay your rent, right? And so they're able to marry that really well. And I think what master leasing does is it provides the ability for folks who are very much trauma-informed, relational, come from that aspect to be a property manager in that way. So I know Humility Homes in Davenport, they do a ton of master leasing where they've established relationships with landlords over years in the community to say, we will guarantee and make sure you get your rent every month if you let us be the people that run the show here. And they handle kind of wear and tear and have kind of a working relationship with.
Was that one of the,
landlord.
I'm sorry to interrupt,
Yeah.
was that one of the 7 groups? Yeah,
Yep.
'cause I was
Yep.
at the conference.
Oh,
and I was
wonderful.
like,
Yeah, yeah,
so
yeah.
I was like, wait, yes,
Yes.
that is very familiar.
And so we can connect you with them. They have a really successful model doing it that way. And so the landlord's happy because they're getting their rent paid. They're not having to, essentially, they're not having to deal with a renter at all. Somebody else is doing all of that work, including all of the repair. But the other piece of it that they're doing is they're making sure somebody stays housed that probably would get evicted normally. From a larger building perspective, I don't know the answer to that. Like if there's, I'm thinking like a fourplex, I could see like master leasing working there, but I don't know about a bigger a bigger one. I'd have to look into that and get back to you on that, but it's a great idea.
I was thinking,
Yeah.
new construction's so expensive. If
It
there was
is.
something that was already
Yeah.
large enough.
Yep, absolutely. I think that's part of all of this conversation, is that we can't build our way to where we need to be. And so it's going to be, what are all the different pieces we're bringing to the table on this, and acquisitions part of that.
I was,
I can jump in real quick. Jumping back to Supervisor Fixmer Rise's sort of back of the napkin sort of
Yes.
penciling. So my same apologies if I have these numbers wrong, but just thinking about some of the hardcore dollar and cents kinds of things. For just if I did this correctly, the supportive services part of the permanent supportive housing would, if we hit what our full need, am I correct? That would be probably an annual cost of between $4 and $4.5 million for that part of our shelter. I mean, that's just one part of our local shelter services, but is that what we need to be having in our minds to be thinking about for what that would take? And I know that's real speculative, but
I'm not confident I'm tracking the math, but that could be
just-
right. If you penciled it out, I hadn't.
yeah, I think it was like 832,000, I think was what the current.
For
and that's
36,
for-
and then if you, yeah.
Then if I multiply,
If that's the
I might have
number.
used 60 as my number, so it might be bigger than that. So anyway, but yeah, so we're talking something in that ballpark of a commitment that we would need to make, because if we just have the building without the services, what we heard today, and I think we have probably already all knew, is that if you don't have those two things together, then you don't get the success that we want to see and that we have been seeing, correct?
Right. And so then what are the different sources of being able to
And
support
ongoing
that?
and kinds of things. So, yeah, okay. Thank you. Just wanted to make sure I
Yeah.
had the picture.
So I was thinking about, master leasing as well. When I think about master leasing, I think about not to disparage the practice at all, but it basically is just a subsidization of landlords who then make a lot of our money and just for profit, where I've seen other models kind of like globally, they mix in permanent supportive housing with a broader, robust public housing system or social housing system in Europe, where it's mixed income and the higher end of the scale is still municipally owned, but then it's used to subsidize the lower 30% AMI type of thing. So I know that this would involve more building or buying and managing properties, but I don't know if you're familiar with anybody who's used that model of kind of like a mixed income way of, so instead of the money that gets paid in the rent going to some landlord's like house by a lake or something,
Right,
it goes
right.
to back into the system, back
Yeah.
into the care of the community.
Yeah, that's a really good question. I'm trying to think of co-op models that, it's kind of that same idea. I don't know, have you heard of it? Okay.
Yeah.
I can look into that. I mean, I think that European model has come up in different ways. Absolutely. I think I totally agree with you, and I think what I struggle with consistently all the time is that we have federal housing vouchers that go unused across the nation, and it's just money sitting at the table while we have people who can't afford housing. And so I totally hear you. And I'm like, how do we get people into housing? How do we, because not all landlords have the house at the lake. They're the mom and pop shops who have a couple different properties, that they're using as well. But
Yeah.
but I think it's I think it's something we can absolutely look into and have a bigger conversation about for sure.
Yeah, and I was also, I had heard generally that it's a little bit more difficult to convert existing buildings into permanent supportive housing because of, a lot of thought and care goes into the design of the place to be trauma informed, to have the clinics and the hot room for, that type of thing. So I'm wondering if you could speak to that, if you see struggle with that when people try.
So I think it depends on the population that you're going to be serving. I think there are some populations that, if we had all the money in the world and all the time needed, it'd be incredible to do trauma-informed design every single time. That's what we should be doing, hands down. And we've got hotels that could be converted into housing right now. And so I think we're doing a hotel to housing conversion right now in Dickinson, North Dakota. And we have, in that case, there's just a ton of families that are experiencing homelessness that are ending up in the DV shelter that haven't experienced any of that violence. And so they just need a place to land. And so I think for them, it's working out because they definitely have, I'm sure, experienced trauma of some type or source, but they're not long-term chronically homeless folks who have been experiencing severe mental health or substance use for a long, long time. So I think it depends on your population. I think it also just depends on the resources you have available, too.
Yeah.
But yeah, I totally hear you that I love the trauma-informed design aspect of housing.
Absolutely.
It's incredible.
And while I have you, I was thinking about I think back in the slide where it talks, it was kind of showing like what the next steps are, for these next couple months and
Yeah.
the next couple months. So, and I heard y'all saying that the number of units is about 50% of the equation or less than, in terms of these are the amount of units we need, but there's so many more factors other than just building units and that's it,
Yeah.
obviously,
Yep.
and even the wraparound services.
Yep.
So I was wondering what types of things can we expect? What is the scope of the suggestions going to be? Is it going to be as specific as you should build this many units here and this type of unit there? These are the amount of units that should be in each location, or is it
Yeah.
just going to be a little bit more general? And also, what can we do right now to prepare ourselves to inevitably make that step?
Yeah,
Yeah.
totally. Those are great questions. I don't know, Chrissy, do you want to speak to that? I mean, we've done this type of work across the nation. And so I've done plans with communities that are like, we want a 30-page plan that includes a legislative agenda. And so we've done that. We've also done more kind of what do you all, like, almost like beginning conversations around how do you all want to set up a system where you're consistently having conversations about how to do this and do it differently. And it's just us helping you set up those conversations and then you run the show. Or do you want us to bring examples and have conversations with you all to say, okay, we're going to have an action about how to get folks with high barriers into housing. We're going to talk about how we set up expungement clinics or whatever, really specific things like how our police are engaging with folks who are living in encampments. Lots of different kinds of actual actions and pieces around that. So I think this next piece of the work is really, we want to say, how do we as a community in Johnson County and Iowa City, I think really it's up to all of you what you want this to be, and what it would mean for you to take whatever comes out of this and actually walk with it and run with it. So I think those are the next pieces. We never want to come into a community and prescribe, like, here's what's going to work for all of you. I think it's all of you coming to the table and say, this is what we need, this is what we don't need, this is the system we want set up. Yes, we do want actual recommendations, or no, actually we want you to set up an implementation kind of systems, and we'll figure out those key kind of policy levers and other things we need to pull from there. Is that helpful at all? Okay. Is that right? Okay, would you add anything?
I would just say it evolves, right? It's supposed to be an evolution and a engagement with our stakeholders.
Yeah, that's right.
Just
So
to
I'm-
piggyback on that real quick, I mean, in terms of next steps, what are you envisioning in terms of a timeline? Because I think, obviously, you've got us all here now, but I know, and that's kind of what I was wondering if you go back to.
Yeah, we are, so I know this is quick, but we were thinking it'd be ideal if we could start having those conversations. I know October, November, especially November, December start getting really, really busy. So we're going to try to get as many conversations on folks' calendars as we can between now and the end of the year, knowing that's going to probably bleed into the beginning of 2026. But then really, we'd love to come back to everyone you talk to and all of you with kind of this draft, if they're draft recommendations, draft kind of structural pieces by the end of March in 2026 to say, hey, did we hear you right? Or what doesn't make sense? What did we get wrong? What are we missing? And then including all of that feedback, that would kind of finalize those recommendations and that plan, and some proposed investment strategies that would be being finalized through May and then presented final in June. So that's what we're thinking.
I ask because I know sometimes in planning efforts, there's like, a committee or something that helps, to Councilor Weiland's comment about what can we do to prepare ourselves now.
Yeah.
I'm just wondering if it's worthwhile to put some folks together now with Shelter House and with you all to start kind of sifting through some of this so that come, March or April, June, like we're ready to kind of have something off the ground or something like that. I mean, and we could figure out who or what that is, if that's other folks in North Liberty and Coralville.
Well,
And
That's exactly
Can I
my
get on
question.
that? And Chrissy, maybe if this is probably more for you, but has Coralville been involved in this at all, or University Heights? Those are both places that are bus accessible to Iowa City and certainly seem to me that they ought to be involved.
That was my question.
No, they haven't, and we would ask for your help in enlisting their support and engagement. I'm 27 years into this and not successful in.
Yeah, I would just say when the meeting's going to be, and we can try to bring people there. But if they're not invited, they won't participate. So we have to invite them.
There's a joint entity meeting coming up, right?
Yeah, on the 20th.
On the
That we
20th,
don't have an
and-
agenda for yet.
And both of those communities have affordable housing on their list, right?
University Heights, I think. is
You're thinking North Liberty.
I was
Coralville
thinking,
does.
yeah, I said North Liberty.
Oh, he
Or
was
I
talking
meant
University
to.
Heights.
No, sorry.
It's okay.
somebody's got it on their list.
Somebody's got it on their list.
North
Amen.
Liberty and Coralville.
Yep.
Yeah.
Those are the two I was thinking
Right.
of.
Yes, ma'am.
That is a good point. The joint entities might be a great opportunity to do this.
That's Monday, the 20th, right?
Yeah, it's
October 20th. So it does sound like there's a proposal on the floor right now of a committee. Just wanted to maybe get some thoughts on that a little more. If folks are thinking that that's how we should be moving forward.
Yes.
Yeah, I think also, I wonder what steps forward we could do right now in terms of staff engagement and giving direction and prioritization to our staff to utilize their time to do a lot of this work. I don't know if that's something we need to do. Just trying. Yeah.
What would they do right now?
What would they do?
I mean, I'm just saying in
Yeah.
terms of like what
I think
action steps would they have right now?
I'm not sure. I mean, they were talking about,
Or there's vouchers.
beginning to
master
explore
leasing.
some of those answers to the questions that we brought up about, because, they know the ins and outs of our budgets and our expenditures. So some collaboration meeting with CSH Shelter House, other folks.
There's also a monthly meeting that the county hosts called System of Care, where Chrissy and Aaron and others are usually there, and this topic comes up frequently. Bruce has staff at all those.
So Systems of Care used to, it was really reconvened to try to figure out a project, and I don't know if, if they've identified, one area that they want to do, but that's how the Guideling Center was created from that meeting. It had a different name back then, but
I thought also like today we are meeting with the county and us. There is two paths here. That's what I believe. There is path for long term, figuring out what we're gonna find permanent solution, but also we need to talk about the winter is coming. How like the winter shelter. How can we use that right now? Like we open it early, we continue with it, like not close it after. I think March or something like that, remaining still open, just to help the people on the street right now. So we should talk about that also, as I don't know. It's 5:30.
I do know that the winter shelter was Is there an anticipated date
Yeah.
for that opening? If you can share that with us, please.
So we've offered November 17th. We believe we have the building at that time. We haven't received any information as far as the sources of funding that would be available to add time to the winter season.
So are you referring, because I think our contract that the city has with you all is in December.
November.
Is in December. Our
November.
contract is in December, is that correct? Yes.
There is a
There-
mechanism to extend it that exists in that
Yes,
contract.
they're doing it early.
But there's also a gap that exists on that project with the existing timeline. Adding more time to it increases that funding gap. And really, we would love an opportunity to have this conversation and make plans and move forward and address concerns about the possibility of, what about further utilizing the winter shelter space. But it really, it may be one of those imminent or emergent necessary things to consider, but there are costs to doing that, very significant costs, that I would hope you would not want to have compromised the long-term potential impacts that we have through a permanent solution.
Yeah, I do. This has been part of a conversation, and you and your team came and spoke at the county, and we did have the breakdown. And I thought that was sent actually to City Council, as there's line items for what the county was willing to pay, and then asking if we could cost share that gap. And I do believe that was communicated. I guess And so has that?
City manager might have some.
Yeah.
Yes.
Yes, I did get a letter after your meeting, and I believe the response was to share the contract that we have. So we have a service agreement with Shelter House for that winter shelter. We contract for 15 weeks at a specified cost. And then if there's an agreed upon extension of those 15 weeks, so in this case, we're looking at going to 17 or 18 weeks, I think that would be, we would pay a prorated share of our expense. So our commitment is to the winter shelter is kind of flexible. But as Chrissy mentioned, since we're not paying 100% of that cost, while our share increases, it also increases the gap that they need to fill, which would be through other local governments, county, Coralville, North Liberty, or through private donations that would be difficult to raise.
My understanding of the ask was that we had agreed that we would be willing to potentially cover 50% of that gap cost, and we were asking if the city would cover the other 50%.
And we would be covering the 2-week share, unless there's.
Oh, that full 2 weeks.
How many weeks is early?
So we cover 15 weeks at a cost of, I'm going to speak in generalities, of roughly $110,000 of 15 weeks. And our agreement with the shelter house that was passed by council a couple years ago indicates that if there's mutual agreement to extend that to 16, 17, or whatever the duration would be, we would simply take a prorated weekly share and add that to the to our contribution to the 110,000.
So I guess we haven't seen that penciled out, but we would, because it's not what it's sounding like is, first of all, no, which is fine, and that it would be your share, but not covering the actual gap.
I don't know that I hear a no. I hear that the council had already created an agreement that I think it might just behoove, the county to just review and maybe understand before we get into some more dialogue on it.
Thank you.
Yes.
And I think we're covering, so just so I'm going off of memory here now. When you talk about that, what we're covering, the city already is, do you recall like what percentage of the actual cost? Like per
I don't.
week
I
or
have
whatever?
that information, but not at my fingertips.
I mean, that's as.
I have permanent supportive housing in my mind.
Yes.
Yeah, no
Yes.
problem. But it's significant.
Correct.
I think we can circle back to this, but we'll be sure to get that contract over to you all so you can discuss it. And then
That sounds
certainly we can have someone come and explain it.
Thank you.
And I think, just to clarify for this council, I think this council's understanding is that the city did want to extend it for 2 weeks for that early open date.
Yes.
As far as our service agreement.
Yes. And of course, that comes with funding. Yeah. that, but
Yeah, and we would fund it.
Already does, yes.
Yeah, it already does.
So it sounds like for the joint entities meeting, we're going to add some permanent supportive housing on there, it sounds like. And we'll have to work out the particulars on how that will look like outside of this meeting. So is there someone from this, what I would say is certainly we'll want to involve maybe one or two city councilors and two of the county supervisors. Do we want to identify those two right now, and then we can move forward
for the
from?
committee.
I'm happy to be one.
This is just to discuss the
Agenda item.
the agenda item for October 20th, just to figure out what will be on there. We don't have time to do that dialogue right now.
Oh, I see what you're saying, just for that.
I'd be
Yes.
happy to.
I'd be happy to.
I would be happy to.
I will be happy to.
Okay. So I'm going to let the county figure out theirs. I think I heard two from us. So-
Mr. Mayor, I believe the agenda deadline is Friday, so we will want to move quickly.
So we'll get so we can put it on the agenda. It's going to be here at the county, at the city. So we'll put the item on but the particulars will need to be worked out prior to the 20th.
Very
So-
good. We can discuss that tomorrow morning and nail down our assignments.
Okay, so you all can figure out your two, I guess, for the county. For the city, we just, it sounds like anyone else besides Mayor Pro Tem Sala or Councilor Wyline want to be a part of this? All right. Anything else on this agenda item for permanent supportive housing?
So I just want to clarify the next steps so there's no like confusion. So we have created a committee to decide what is going to be on the joint entities meeting.
Correct.
And after the joint entities meeting, where we reach out to Coralville, North Liberty, University Heights, then
Potentially that could, because we heard interest for having those other communities apart, the reason we're bringing it to the joint entities meeting. So if I would actually invite the shelter house to be a part of that discussion to, make sure that that is the right move to have a commission or a committee created, and as well as CHS, but I'll leave that up to shelter house. I think that would be the best next step while you all are having that discussion.
And in the meantime, our collectives, if we all give, head nods, our collective staff could begin to look at a hypothetical funding strategy in the future, or is that something for after the,
Probably something for after the meeting, I'm
Okay.
assuming. But I like where your head's going.
I don't want to jump the gun,
All right.
I also wanted to say thank you so much for
Yeah.
all of
Yes,
the hard
very
work.
much, thank
Yeah,
you.
thank you.
And to your team for being here always. For coming.
And I was going to say, too, I love where you're thinking as well. I think, because I love folks who are action, so I appreciate that. We're going to be having a series of conversations with stakeholders that include government staff, that include nonprofit staff, that include hospital folks, that include law enforcement. And so those will be getting on people's calendars, and information from that will help with that financing piece. But I would love, in past communities we've worked in, we had access to some city staff that was super helpful to be like, hey, does this make sense what we're hearing? Or have you done a housing assessment recently? Can we look at that? Things like that. So we can talk about that more offline as well. But thank
Great.
you.
All right. Well, much gratitude for you all coming and doing this presentation today. Thanks for the individuals that kind of highlighted this to be on our agenda. Thanks to the county supervisors for being here today. And of course, I really appreciate my fellow counselors for their continued support of really our unhoused, because housing, I know that we really do believe it's a human right, and we want to work towards really that solution of no one is unhoused in our community. So thank you all.
I'm glad that's a conversation we're having. We could be having to convince each other that this is a problem.
Yes.
Yeah.
We don't have to do that, so I'm very thankful for everybody.
Good point.
Yeah.
Yes. All right. Thank you all for coming. Yes.
Mr. Mayor?
See you guys soon.
Yes.
I know you have a couple pro forma items left on your agenda.
Yes.
I would just ask for the county's purposes, since we're going to utilize your minutes,
Yes.
I would just ask that the clerk indicate in the minutes that the county was dismissed at 5:36 PM.
Great, and we'll ensure that we include all the county member names, the Board of Supervisors' names. Thank you.
Thank you, sir.
Yes.
Thank you.
You already brought them up, but I just want to give some notes. All right, we're going to continue with our agenda. We're going to move on to item number 2, clarification of agenda items. Relatively short agenda. Hearing nothing, we're going to move on to
Can I ask a very quick-
Absolutely.
This is so silly because I should know this. With clarification of agenda items, is it simply to say you want to pull something out, or is this a place where I can ask a question about an agenda item?
It is a place where you can ask a question, but you have to determine if that question should be saved for that is more of a, it's not really a question about the item, it's more of a
I have a question
process
that's,
or
no, I have a
process
question that's specifically about the content of an agenda item.
Okay, sure.
So actually with this, what was it? Oh my gosh. In the consent agenda, it is the item dealing with the safe bird
Yes,
community.
yes.
I just wondered, there's one piece in the resolution that talks about, protecting birds, and what does that look like? I know, I have seen and heard from a lot of neighbors about they get upset with cats roaming around, and so is it that we're going to,
So would that
So is
be
this the type
something
of
that
thing where
staff
this
can
comes
come
here?
back, just, you
yeah,
can
we
make
don't have to
note?
talk now. I
Yeah,
just,
you can just make note that that's a question that you're going to ask, and if staff can prepare
go.
to
all right.
answer that. All right. Any other agenda items? Hearing none, we're going to move on to item number 3, information packet discussion, September 18th. Moving on to September 25th. Moving on to October 2nd. I will just say that we already clarified one agenda item for the joint entities meeting, which will be held here at City Hall, 4:30 on Monday, October 20th. Are there any other items that this council wish to throw out there for consideration?
I do
for
not.
majority?
I think I do.
No.
Any other items? Okay, hearing none. We're going to move on to item number 4, which is University of Iowa student government updates, and don't see them present. We're going to move on to item number 5, which is council updates on assigned boards, commissions, and committees.
Economic Development Committee met last week, and got a wonderful presentation from Rachel Kilberg-Varley on TIF and how it's been utilized in our community over the past and its benefits. So, of course, that is recorded for anyone to watch. If you have questions about it, we're happy to answer them.
Since you talked about TIF, I do, if we were to, we know it'll often backtrack, but joint entities, will there be any benefit to having, just talking about loss? Just a brief overview for,
I think that's a good idea.
I think that's a good
Just to
idea.
give us the ability to talk about it.
Yes.
yeah.
It could be a key, or it could be a large part of permanent supportive housing too, if it passes. So I think that that's pretty germane.
Possible. Yeah, you could have somebody from the Lost Committee just come and give a short presentation on how their campaign is going. I think that would be appropriate, and they'd be the appropriate people to come and
Discuss it.
speak.
Are
And then we
folks-
could obviously comment from there.
Are folks okay with that?
Sure.
As that would be who will invite? Okay, I don't hear any objections, so we'll
Would
go
that
with
be
that.
an invitation to Greater Iowa City to talk about it, since they're doing the campaign? Is that what we're thinking? And then other communities?
I assume that's who you were referring
yeah,
to.
yeah,
Okay.
that's,
Okay,
that's, thank
so
Kind of what I
Greater Iowa
envisioned,
City
but I
Inc.
just put a word to it, so.
appreciate that.
Okay.
Can I say something that was in the IB?
So, yeah, so let us, I know I jumped in on a previous agenda item. Any more updates on boards and commissions, and then we'll go back to item number 3. Hearing no more updates, we're going to go back to item number 3. And are there any of the information packet discussions, either September 18th, September 25th, or October 2nd, that anyone wants to address?
I guess for October 2nd, I just want to highlight, not to address anything, but I want to highlight as of October 25, the waiting list for Section 8 was 2,503, and that include 1,125 Iowa City residents. So still, we need more affordable housing.
Okay. Anything else from item number 3? All right, with that, we have no other items on our agenda. We are adjourned. See you at 6 p.m. Mics are on. It is 6 p.m., and we want to welcome you to the City of Iowa City's formal agenda for October 7, 2025. I'm going to call this meeting to order. Roll call, please.
Alter?
Here.
Burgess?
Here.
Harmson? Mo?
Here.
Saleh?
Yes, here.
Teague?
Here.
Wyline?
Here.
Well, I want to welcome everyone to your City Hall that is present here, and to those that are joining us online, welcome as well. We're going to jump right into our agenda, which is item number 2, proclamations. 2A is Domestic Violence Awareness Month, and this will be read by Councilor Megan Alter.
Whereas domestic dating violence and stalking affects people of all racial, cultural, and economic backgrounds, causing long-term physical, psychological, and emotional harm. And whereas 1 in 3 Americans has witnessed an incident of domestic violence. And whereas children who experience domestic violence are at a higher risk for failure in school, mental illness, substance abuse, suicide, and may choose violence as a way to solve problems later in life. And whereas domestic violence in rural communities exists as a hidden, silent, and often unrecognized crime that is often underreported. And whereas through the inspiration, courage, and persistence of victims of domestic violence, their children, and advocates, our communities are learning to recognize the impact of violence in the home and within intimate relationships. And whereas DVIP, RVAP, Domestic Violence and Sexual Assault Crisis Services, has worked to end violence in intimate relationships for more than 46 years through the collaborative partnerships of advocates, volunteers, local municipalities, criminal justice, health and human services, faith communities, business leaders, and private residents. And whereas our community's achievements should be commended, and we must continue our commitment to respect and support victims of domestic violence and to prevent future violence in our community. Now, therefore, I, Megan Alter, on behalf of Bruce Teague, Mayor of Iowa City, do hereby proclaim the month of October 2025 to be Domestic Violence Awareness Month in Iowa City, Iowa, and urge all community members to work together to eliminate domestic violence, dating violence, and stalking from our community. And here to accept this proclamation is Alta Medea, the Community Engagement Director for DVIP and RVAP.
Hi. Thank you all so much. As always, the City of Iowa City is one of my favorite places to be. That's why I'm here every year. It's where I call home, and we are so incredibly grateful as an agency for all of the support that the city has provided us for our emergency shelter, transitional housing, and just supporting victim survivors of domestic and sexual violence and assault. We truly could not do this work without the community that we have here. It's absolutely vital to everything we do. Earlier, I dropped off some handouts with you all, and I just wanted to highlight a few things. I don't want to take a ton of time. I know there's lots of proclamations and work to be done tonight. But I did want to point out that in the past fiscal year, so July 1 to June 30th of 2025, we served 1,619 individuals that are from here in Johnson County, and 1,091 of those individuals were in Iowa City alone. That number is staggering and requires that we all continue to do this important work together. I also wanted to bring up our Shop for Shelter event. This Saturday, we are hosting Shop for Shelter. It is our biannual, we now do them twice a year, in-kind donation drive, and that provides items for victim survivors, everything from non-perishable food items to formula and diapers, those types of things at all area Hy-Vees and Fairways. But if you prefer to shop at Costco or Aldi's, you can go ahead and pick those items up and still drop them off with our volunteers. That's this Saturday morning. And then we also have the Clothesline Project. And so on the other side of your page, there is a link to that. It is on October 21st. The Clothesline Project is an event that is open to the public to increase awareness and allow folks to make a shirt in honor of someone they know or themselves and what they've experienced. It is allowing us to bring a conversation to the community and give a safe space for victim survivors to share their stories. So that will be at the end of the month, but that is everything. Thank you all so very much once again for this.
Thank you. Item 2B is Fire Prevention Week. This will be read by Councilor Wyline.
Thank you, Mayor. Whereas the City of Iowa City is committed to ensuring the safety and security of all those living in and visiting Iowa City, and whereas fire is a serious public safety concern both locally and nationally, and homes are the locations where people are at greatest risk of fire, and whereas home fires killed 2,890 people in the United States in 2023, according to the U.S. Fire Administration, and fire departments in the United States responded to 344,600 residential fires. And whereas working smoke alarms cut the risk of dying in reported home fires in half, and 3 out of 5 home fire deaths result from fires in properties without working smoke alarms. And whereas half of home fire deaths resulted from fires reported at night between 11 p.m. and 7 a.m. when most people are asleep. And whereas Iowa City's first responders are dedicated to reducing the occurrence of home fires and home fire injuries through prevention, protection, and education. And whereas Iowa City residents are responsive to public education measures and are able to take personal steps to increase their safety from fire, especially in their homes. And whereas the 2025 Fire Prevention Week theme, Charge into Fire Safety, TM, lithium-ion batteries in your home, effectively reminds us the new challenges and causes of home fires and home injuries. Now, therefore, I, Oliver Wyline, on behalf of Bruce Teague, Mayor of Iowa City, do hereby proclaim October 5th to the 11th, 2025 as Fire Prevention Week. And here to accept is Fire Marshal Axel Swanson.
Thank you. Mayor, council members, on behalf of the Iowa City Fire Department, I'm honored to accept this proclamation recognizing Fire Prevention Week 2025. This year's theme, Charge into Fire Safety, Lithium-ion batteries in your home, highlights an important safety topic for today's homes. From cell phones and e-bikes to laptops and power tools, lithium-ion batteries power so much of our daily life. When used and charged correctly, they're safe and efficient. But if damaged, overcharged, improperly stored, they can pose real fire risks. So throughout this week, our department will share safety tips to help residents use, charge, and store these batteries safely. Everyone can learn more by visiting the National Fire Protection Association at nfpa.org or by contacting the Iowa City Fire Department directly. We're always here to answer questions and help you keep your home safe. Thank you for your continued support of fire prevention and life safety in our community. Together, we can keep Iowa City safe and secure. Thank you.
All right, we're going to move on to item number 2C, Indigenous Peoples Day. Whereas the city recognizes the fact that Iowa City is built upon the homelands of Native American nations to whom we owe our existence, commitment, and dedication, and without whom the building of the city would not have been possible. And whereas the area of Iowa City was within the homelands of the Iowa, Meskwaki, and Sauk, and because history is complex and time goes far beyond memory, we also acknowledge the ancient connections of many other indigenous peoples here. And whereas Indigenous Peoples Day was first proposed in 1977 by a delegation of Native nations to the United Nations sponsored International Conference on Discrimination Against Indigenous Peoples in the Americas, and whereas the City of Iowa City recognizes its shared responsibility to honor our nation's indigenous roots, history, traditions, and cultural contributions. Whereas the city strongly supports that Indigenous Peoples Day shall be an opportunity to celebrate the thriving cultures and values of the indigenous peoples of the region. And whereas the city is dedicated to opposing systemic racism towards indigenous people, which perpetuates high rates of poverty and income inequality, and exacerbating disproportionate health, education, and social crises. And whereas the city implores our residents to commit to understanding and addressing injustices impacting indigenous people, and whereas the city strongly encourages educational institutions, businesses, and other organizations to recognize Indigenous Peoples Day and join the city in committing to opposing and overcoming systemic racism and injustices. Now, therefore, I, Bruce Teague, Mayor of Iowa City, do hereby proclaim the second Monday of October each year as Indigenous Peoples Day in Iowa City. And to receive this, accepting this proclamation, is Joe Maxwell and other students from the Native American Student Association.
Thank you, Mayor Teague and City Council members. I'm grateful on behalf of Iowa City's Native American community to accept this proclamation. And I'm grateful for these symbolic gestures because as we enter into the agreement of the future together, it's just good knowing that everybody's hearts have the right posture. And with that, I want to emphasize that entering into the future with the correct heart posture is the right thing to do, and turning that heart posture into good actions with our hands is the next right thing to do. So I'm excited to see how Iowa City turns this intellectual understanding of Indigenous peoples' rights to the land into an embodied awareness and internalization of these things. I noticed there's a lot of folks here that are celebrating and showing solidarity for the Palestinian cause. And as we continue to move into a future where Indigenous voices are being killed, to look for ways to protect Indigenous lives wherever they may show up. Thank you again.
Thank you. The National Disability Employment Awareness Month is going to be read by Mayor Pro Tem Sala.
Whereas the purpose of National Disability Employment Awareness Month is to provide education about disability, employment, and celebrate the many and variety contribution of American workers with disability. And whereas October 2025 marks the 80th anniversary of National Disability Employment Awareness Month, and whereas its history tracks back to 1945 when it began as a week-long recognition of people with physical disability, but later evolved into a full month that acknowledge the importance of increasing the workforce inclusion of people with all nature of disability. And we are supporting the talents and careers of Iowa citizens with disabilities and creating meaningful experience in the workplace is an essential ingredient to building an inclusive community and a strong economy. And whereas activities during this month will reinforce the value and the talent that people with disability add to our workplace and communities, and affirm Iowa City's commitment to increase access to good jobs for all workers, include workers with disability. And whereas Iowa City's long-term success is depending on empowering all individuals with ability to work to express their talent in the workforce, filling open jobs, and enhancing the quality of life throughout the community. And whereas Iowa City is committed to cultivating a positive, welcoming environment where individuals can pursue careers opportunity across many different occupations that welcome their skill set and help them reach their goals. Now, therefore, I'm Zahar Saleh on behalf of Bruce Teague, Mayor of Iowa City, hereby proclaim the month of October 2025 as a National Disability Employment Awareness Month and call upon employers, community organizations in Iowa City to participate in the observance of the appropriate programs and activity in October to help ensure that workers with disability have access to good job every month of every year, and to like to take steps throughout the year in pursuing of the goals of opportunity, full participation, economic self-sufficient, and independence living for people with disability. And here to accept is Monica Brockway, Vocational Rehabilitation Services Supervisor for Iowa Workforce Development and a member of the Disability Service Committee.
Good evening. I'm going to lower this. Thank you, Mayor Teague and council members. First off, I want to acknowledge the City of Iowa City partners and our local employers for their commitment to this mission, not only during the month of October, but for the work that you do year-round to improve outcomes for Iowans with disabilities. Thank you. Creating positive employment outcomes requires close collaboration at all levels, the city, the state, and our local employers. Thank you for everything that you do. Today, I'm accepting this proclamation on behalf of Iowa Vocational Rehabilitation Services, a division of Iowa Workforce Development, which administers the state VR program and helps Iowans with disabilities find sustainable employment. October is an important time for us for many reasons, most importantly because it presents the opportunity to really showcase the work that happens every day to support Iowans with disabilities. NADIUM is observed nationwide to highlight this employment practice, programs, and skills and talent that individuals with disabilities bring to the workplace. We don't just offer these programs in Iowa, it's nationwide, and we are proud to embrace an employment-first philosophy so that competitive integrated employment is the first and preferred outcome in everything that we do. This means that individuals with disabilities are provided the same opportunities to work in a career and earn a living similar to any other person without a disability. VR is committed to recognizing the vital role that Iowans with disabilities play in strengthening our workforce and our communities, and also improving the system that makes these outcomes possible. During NADIUM, our division is providing resources, hosting events, and highlighting success stories from across the state and right here in Iowa City that speak to this important need within our workforce. The City of Iowa City ADA Committee will be hosting an ADA Job and Resource Fair this Friday afternoon from 12:30 to 3:30 in the Ped Mall. We will be joined by employers, job seekers, and partners interested in creating a more inclusive workforce. We hope to see you all there. Thank you very much.
Great, thank you. And thanks to everyone that came for proclamations. All right, could I get a motion to accept the DVIP and RVAP correspondence, please?
So moved, Mo.
Second, Wyline.
All right, all in favor say aye.
Aye.
Aye. Any opposed? Motion passes 7-0. All right, we're going to move on.
6-0 with
Oh, 6-0, that is correct. All right, thank you. We're going to move on to our consent agenda items, which is items 3 through 8, except we're going to do a separate consideration for 6J. Could I get a motion to approve, please?
So moved, Mo.
Second, Saleh.
All right. Anyone from the public like to discuss this topic? If you're online, please raise your virtual hand.
Mayor Teague, do you mean 6J or the other?
So 6J for separate consideration.
Not yet.
All right, so seeing no one in person or online, council discussion?
I had a question actually about 6F, which is about a bird-friendly community. And in the resolution, I just want some clarification if there is any to be had. In some of the language, it talks about persons who are enthusiastic about birds, informed about the threats they face, and empowered to help address those threats can directly contribute to maintaining healthy bird populations, and I guess that pretty much encompasses it. I just wondered if there was any specifics about what that was, about what does community members who know and like birds addressing threats.
Yeah, it primarily speaks to just how the city cares for our natural areas, so our prairies, our wetlands, our woodlands, and making sure that we're thoughtful of birds as we care for those and expand those types of areas. But it also recognizes that we have partnerships with a lot of organizations and just passionate individuals. So if you go through some of our parks or along our trails, Terry Trueblood or Waterworks or Sycamore Greenway, you'll see bird habitat, little houses for certain types of birds. Those are all done in partnerships with community organizations or individuals, and I think it's probably speaking towards some of those things. So this is a designation that cities across really the globe can achieve. There are several in the Midwest, and as we evaluated our own practices, we felt like we already meet that criteria, and thought that it would be good to get involved with this organization to a deeper level.
Yeah, no, I think it's a fantastic resolution. I have to admit, I went a little bit into a dire land just because I do know that there are passionate people, and I have seen many a neighborhood conversation about those damn cats that are out getting the birds, and I was afraid we were going to have some vigilante neighbors. So I wanted some clarification, and it helps to sort of get the broader expanse of what this is about, and I think it's fantastic. Thank you.
All right. Any other items or discussion from council? Hearing none. Roll call, please.
Mo? Yes. Sala?
Yes.
Teague?
Yes.
Wyline?
Yes.
Halter?
Yes.
Burgess?
Yes.
Motion passes 6-0. We are on to item 6J. Could I get a motion to give consideration, please?
So moved. Alter.
Second, Wyline.
All right. Anyone from the public like to address this topic? If you're online, please raise your virtual hand. If you're present, please come forth, and you'll be allowed up to 3 minutes to speak. And there is also a sign-in at the podium. Oh, I am sorry. I'm going to read the item. So 6J is trash compactor procurement. Resolution authorizing the procurement of one new trash compactor for landfill operations. And that is the item. And welcome. Please state your name and city you're from. You'll be allowed up to 3 minutes.
Hi, my name is Ezra Wright. I'm from Iowa City. I just wanted to bring it to the awareness of the council. There are many people here tonight in support of the Palestinian cause, specifically because the trash compactor in question is a Caterpillar trash compactor. Caterpillar operates in illegal settlements in the West Bank. Caterpillar's bulldozers are used to destroy Palestinian homes and kill Palestinians. The D9 bulldozer was designed specifically for use by the Israeli occupation forces. The BDS movement calls clearly for a full economic boycott of Caterpillar. In particular, this issue should be of high priority in Iowa City because in 2003, American activist Rachel Corrie was murdered by the IDF using a Caterpillar bulldozer. She was in Gaza defending the home of a Palestinian family she was staying with. 2 of Rachel Corrie's aunts are longtime residents of Iowa City. Imagine how they must feel knowing that the city continues to do business with the company that facilitated her murder. Imagine how Palestinian community members feel seeing the city use the very machines that are used to destroy their homes. The Israeli occupation uses Caterpillar machinery as weapons of genocide against Palestinians. And for as long as Caterpillar maintains its partnership with the occupation force, it will be a target for boycott and divestment. Alternatives to Caterpillar exist. In August, this council voiced its support for the Palestinian cause. This is a time to put Iowa City's values front and center, taking actual material action in line with the international call for boycott, divestment, and sanctions. If Iowa City moves forward with this purchase, we will remember it. We'll remember it with every further platitude we hear from this council and with every future symbolic proclamation that is issued. What is the city council going to do when alignment with human rights is inconvenient? I think we're about to find out. Thank you.
Thank you. And we're going to ask people to hold their applause. Welcome. Please state your name and city you're from. And if you're online and you want to, this is an item that folks can comment on. If you're online and want to comment, please raise your virtual hand. Welcome. Please state your name and city you're from.
My name is Pat Miner, and I'm from Iowa City. I've lived here for, I actually came here to go to college, and I've been living here ever since because I find Iowa City a wonderful place to live. And as many of you probably know already, I have been an activist in Democratic politics for at least 20 years. And during those 20 years, one of the things that's been foremost in my mind has been the Palestinian people and being a voice for the voiceless. And they are now becoming, people are becoming more aware of it, politicians are becoming more aware of it because of the genocide that's currently going on in Gaza. And this is one of the reasons that we have been so adamant at bringing things to the fore, is because there is a genocide going on currently in Palestine or in Gaza by Israel. And actually things aren't much better in the West Bank. If you follow there at all, Palestinians are being pushed out of their homes every day. They're humiliated at checkpoints. There's no end to understanding exactly what's going on. Some of you may remember that a few weeks ago, we brought before the City Council a BDS resolution, which was passed unanimously. Unfortunately, what was taken out of that resolution was the part of it that would have included purchasing in this resolution. And this is exactly why we wanted it to be included. We don't want Iowa City to be complicit in buying caterpillars that participate in genocide. And we think Iowa City is forward enough thinking that that you can agree with us. You proved that 2 weeks ago or 3 weeks ago, however long it was, when you passed the resolution, 7-0. And now all of a sudden, we're suddenly being complicit again by buying a caterpillar that causes, as you heard, deaths among Palestinians and at least one American. So I would urge you, please, to think twice about what it is you're doing and whether or not you want to continue being complicit in this genocide. Thank you.
Thank you. Welcome. Please state your name and city you're from.
Hello, my name is Clara Reinen. I live here in Iowa City, Iowa, and I also am here to urge you to reconsider purchasing this piece of Caterpillar equipment. As we've already heard, Caterpillar was responsible for the death of Rachel Corrie in 2003. I do think it's important to note that Caterpillar has been responsible for the deaths of dozens, hundreds of Palestinians, and the fact that we occasionally care more about when a white woman was killed, I think speaks to, as folks said earlier, the way that we tend to dismiss Indigenous struggles, regardless of where they are. I had the opportunity to portray Rachel Corrie in the play My Name is Rachel Corrie last year. And so I just wanted to read some quotes that have stuck with me since I was in that. These are from her journals. Quote, currently, the Israeli army is building a 14-meter-high wall between Rafah and Palestine and the border, carving a no-man's land from the houses along the border. 602 homes have been completely bulldozed, according to the Rafah Popular Refugee Committee. The number of homes that have been partially destroyed is greater. From another email to her mother, she says, quote, love you, really miss you. I've had bad nightmares about tanks and bulldozers outside our house and you and me inside. Sometimes the adrenaline acts as an anesthetic for weeks, and then in the evening or at night, it just really hits me again. A little bit of the reality of the situation. I am really scared for the people here. Yesterday, I watched a father lead his 2 tiny children, holding his hands, out into the sights of tanks and a sniper tower and bulldozers and jeeps because he thought his house was going to be exploded. This is in an area where Sunday about 150 men were rounded up and contained outside the settlement with gunfire over their heads and around them, while tanks and bulldozers destroyed 25 greenhouses, the livelihoods for 300 people. This was in 2003. 22 years have passed. What are we going to do about it? I want to leave you with this quote, one of the quotes that I find the most meaningful from Rachel. Quote, "I look forward to seeing more and more people willing to resist the direction the world is moving in, a direction where our personal experiences are irrelevant, that we are defective, that our communities are not important, that we are powerless, that our future is determined, and that the highest level of humanity is expressed through what we choose to buy at the mall." End quote. This is an opportunity for you on City Council to prove that your humanity is not determined solely by the money that you spend on construction equipment. You can choose not to buy this piece of equipment and carry forward from there. Thank you.
Thank you. Welcome. Please state your name and city you're from.
My name is Uchechi Anamnachi. I'm from Iowa City. I am here as well to urge the City Council to vote no on this resolution approving the purchase of a Caterpillar trash compactor, and as well to remind the City Council of the commitment to Palestinian humanity that they made just over a month ago. It doesn't seem right that the City Council should approve sanctions on this company, Caterpillar, in the most minor form while continuing to do business with them to the tune of $1 million. I know that the city staff are tireless and hardworking, but the resolution passed in August of 2025, I think, should be an indicator that there is more due diligence to be done, that when choices like this appear, we have to work around them. I am hoping that the City Council votes no today and starts to look for a way to work around participating and being complicit in genocide. Thank you.
Thank you. I'm going to invite you to write your name, and if anyone did not write your name or leave a sticker in the basket, I'm going to ask you to do so after the last speaker come forth. And I'll also remind folks that in the back there are stickers or name sheets that you can just place in the basket. Welcome. Please state your name and city you're from.
Numan Abu Isa, Iowa City. I am joining my fellow friends here and people who of humanity who care about what's going on. I just want to read you a little bit. Rachel Corrie was killed by a bulldozer manufactured by Caterpillar. She tried to stop the bulldozer from bulldozing her friend's house, and she was wearing an orange vest. And the bulldozer kept going on top of her, and he backed on top of her again to make sure that she is killed. And the parents of Rachel had a lawsuit against Caterpillar. And the court dismissed the lawsuit. The lawsuit was that Israel is using Caterpillar equipment as weapons. And the court sided with the establishment, with the corporation. So it's your choice now to side with the corporation or to side with the people. I would urge you, actually, Rachel Corrie's aunt is one of our, she lives in the Iowa City area. She is, her aunt is a friend of ours, and she's been in this hall many times. And if it was up to me, I would look for a hall to call after Rachel Corrie, not to approve a bulldozer who killed Rachel Corrie. So I would ask the City Council to look for other alternatives. There are plenty of alternatives out there, and this is a statement for the city of Iowa City, and we wish that you guys can really speak our voice and stand with us. Thank you very much.
Thank you. All right. We will move on to council discussion.
Oh, sorry.
I could just say that being the one who, pulled this from the agenda, I wanted to thank the city staff for making sure that the city council was aware of this and being extremely transparent about it. Technically, the city staff is not violating the terms of the resolution we passed in August because, like an earlier commenter said, that was not about purchases like this. It was about direct investments. Immensely impactful what we did. I wish it had included purchases, and that's something I think we should do in the future. But I just wanted to put that context out there that staff was very transparent and helpful through this. And I think city staff now is going to give some context, perhaps.
Yeah, I just want to share a little bit of our history using CAT and why we do out at the landfill. So this purchase is for a trash compactor out at the landfill. It's an essential tool for the work that we do out there every day that we're opening and operating out there. It's been over 30 years, I can't tell you how long, that we've used exclusively Caterpillar equipment out at the landfill. That equipment is used in very tough conditions, as you might imagine. And one of the critical reasons that we select Caterpillar is because of the service that's available. So we have our own service folks that can do some things, but we rely very heavily on the Althofer, who's the Caterpillar dealer, to come in and service. They're on site at the landfill, usually weekly, performing service, so that those pieces of equipment can stay in operation and perform the duties that we need them to do. Caterpillar is used at the vast majority of all landfills across the state of Iowa. We identified two other options that could be pursued. Both have significant drawbacks for our operations, and I want to talk a little bit about that. The two other options are Volvo and Bomeg. Both Volvo and Bomeg do show up on some divestment lists that we can find online. There seems to be a number of different types of boycott and divestment lists out there. Some appear, Volvo and Bomeg appear on some, not others. Our primary concern with moving to either of these operations is that service component. We're aware of one other landfill that uses Bomeg equipment. That service would come out of Des Moines, and we fear not only that we'll have significantly more downtime, but also question the level of commitment that we'll get from the service tech if we have a one-off piece of equipment as opposed to the entire fleet like we have right now of Caterpillar equipment. The price for all three units appears to be relatively the same. There's some add-on features that we wouldn't know exactly how those are going to calculate with the new equipment that we've never used. And then we've got some software integration things that we would have to figure out that frankly we don't know the answer to now. That would be trash compaction and GIS features that are currently kind of all synced with our Caterpillar equipment. That would, obviously with this one piece of equipment, we'd have staff operating something that doesn't speak to the same proprietary types of GIS and compaction monitoring equipment that we have. So we do have some significant concerns moving off. It's not as simple as just buying a different alternative. And I want you to be fully aware and transparent to the public that the alternative that we buy could also be questioned as well in terms of its complicity in the Palestinian matter that you heard about earlier today.
How do you spell that? I'm looking online.
Volvo and Bomeg, B-O-M-A-G.
Okay.
B-O-M-A-G.
M-A-G.
Yeah.
Thank you.
I suppose I could give my perspective that, so one thing that, always comes from taking action like this is there's always obstacles, there's always hurdles, uncertainties in the future, but I think it's just about taking it's about not being afraid of those things and maintaining that character, that commitment to human rights that we have as a city. Caterpillar is one of the billboard organizations of what you see when it's sponsoring Palestinian ethnic cleansing. And that added with the context of Rachel Corrie's family still living in Iowa City, the context of we just passed a resolution, and I just don't feel that this would be in the spirit of said resolution. That today is also the 2-year anniversary of, it's October 7th today, it's the 2-year anniversary of the beginning of this iteration of the genocide that's happening. And the fact that just today a resident, I won't name him because I don't remember if I got explicit permission to use a name, but a resident showed me a video of a Caterpillar bulldozer that destroyed part of his neighborhood. Yeah, my family sent me this video of it happening recently. So with all those things combined, I know that there are challenges. I would say at least what we should do today is to have staff explore those challenges a little bit longer. If not, just vote no today. I would be agreeable to either of them. So we can get more context, direct staff to explore some of the challenges that they're talking about a little bit more in depth, and then bring us maybe some options, some side-by-side comparisons of what we can be dealing with in the future.
Would you like to make a motion to defer?
I would be agreeable to that. I would also be agreeable to just voting no.
Can I ask a question, actually? And I don't know if staff can answer it or not, but in terms, do you know of other examples of landfills where there have been the different software, that integration, those different models?
I'm sure there are, but I'm not aware of them. We could do that research and come back to you.
That would be part of the research
Yeah.
that I'd be interested in, to know about
Yeah.
functionally how that integration can happen.
Yeah, we can
'Cause
do that.
Otherwise, I mean, are we talking essentially saying we lose a compactor if they don't speak to each other?
Yeah,
Or
it's
is it
probably,
that they really are just working on two different systems? So
Yeah.
I'm not expecting answers, but those are the questions I have for
yeah,
staff to be able to
we
look into.
could come back and elaborate on that.
I would also, one thing I forgot to mention is the specific list that was agreed upon and decided upon by the city council. The other two options do not appear on that list. For context, a lot of the lists that go up there have different levels of culpability, and I think as a city council we decided on this particular highest level of culpability. And like I said, Caterpillar is kind of like the billboard example of companies that are complicit in what is going on. So I just think it would be woefully out of character, out of the spirit, out of the character for our values that are on all of our screens right now, and out of step with the resolution we passed, out of the spirit of it. Like I said, I know that there can be challenges, but I think as a community, when it comes to standing for what's right, those challenges are worth, those risks are worth taking. Those challenges are worth persevering through. So that's how I feel.
Just think that, like, since Caterpillar has long been documented even by the UN and Amnesty International for supplying equipment used to demolish Palestine home, I think this is not, like, how can we just pass something like even last month or when, I don't remember even, and everybody was very excited about that, and suddenly we are purchasing something from this company. I really just will prefer that the staff look for another alternative and vote no for this today, or maybe just like postponing and if you want to put it on the agenda, put it again for purchases with somewhere else that not killing the Palestine people.
I would be amenable to, I'd like to make sure that staff has the opportunity to look at what possibilities there are for these options, right? Like, what would the challenges be in looking at these other systems? But also, are they insurmountable? It doesn't sound like they are, which I think is very positive. So, I mean, on its face of it, I think that given all of the context that has been laid out, that it makes sense to look for an alternative.
I'm just interested in procedurally what's the cleanest thing, but
Yeah.
no one come back with more information or actually delay.
I would suggest a motion to defer.
Defer.
And give some direction maybe for, in the meantime, a memo or a presentation during the meeting, or?
Yeah, we could, I'll think this through. We could either do a memo in an IP and talk about it in a work session, then you can direct us to what you'd like to place on the agenda. That way we avoid potentially trying to guess at where you're going to land with a specific resolution that's pre-prepared. So I'll give that some thought, but probably return to you with a memo, either in work session or at a regular formal, leaning towards work session.
Yeah.
Was like bringing an alternative company, not this one, right? All of us were not agreeing for Caterpillar.
So,
Is that what I'm hearing?
yeah, so I think, thanks for highlighting this, thanks to staff, thanks for the public coming to talk about this. I tried to do a little of research, but I think as I'm understanding it, there are a few companies that are really highly involved, and Caterpillar, is one of them. The others, Volvo and Bomag, may not be to that degree if they're the only options. And so, with that information, I don't know that I need to delay today's vote. I think I can vote on the Caterpillar item and still have staff come back with some options for us. At least that's what I'm.
That's what I'm thinking.
What I'm thinking. It doesn't seem like the right thing to do to delay it, and have that still as an option when I'm hearing that that is not what at least the individuals that have spoken so far would like to do.
Yeah.
I think that will be the right thing, just to vote no.
Yeah, I agree.
Yeah, that's like a bold statement. Yeah, let's do it.
And I know, and I know that technically this isn't buying from Caterpillar themselves. This is buying through a company that has already bought the Caterpillar. That characterization is
dealer.
correct. It's a dealer, yeah. So, but it still makes the same statement. This company is going to be like, wow, we missed out an opportunity for over $1 million because, so that's where the material value of something like this comes from. I'm ready to, unless anybody else has anything to say.
I have a single question, and
Yeah.
that would be mostly for our city attorney, and that is for I guess it's not horizontal or vertical infrastructure. Are there any competitive bidding requirements that we would want to consider for choosing between the two others that we're looking at right now?
No, I wouldn't consider the purchase of this form of equipment as a public improvement, so I don't.
We can
Well, maybe
select,
am
we
I-
can select the equipment that we choose, not one that's the lowest competitive bid.
Oh, right, yes, that's right. We could select something that isn't necessarily the least expensive. That's true. We
Okay.
could do that.
Thanks.
For these types of purchases, we use cooperative purchasing agreements. So these have already been competitively bid by another government agency, and we're able to use their bidding process to justify the expense.
Sure, yeah, well, that's good. We're not running afoul of any state bidding laws.
Yeah, that would speak to our purchasing manual as opposed to public improvement project.
And I also want to reiterate that, this wasn't anything that staff was trying to do sneakily. Like, they were doing just what we told them to do, basically. So, no shade. I want to make sure that they were very, they brought it up to us very transparently. Wasn't trying to hide anything. So, I just want to thank y'all for that.
Yeah, that's happened. Yeah, that's true. Like the city manager told us about this, and after that we can decide. But I really want to raise something like, if we really want to really boycott and make it like really clear, I don't believe we need those kind of items to come anymore to us. for like, we know, we made it clear we don't want to invest. And I thought, I don't know, it's my bad. I thought even invest means even the purchases will be included last time, but now I just surprised that is not. So if this item now today, we don't want to vote for it and we're going to vote no, I think similar item will vote no too. That's why we should make it clear to the staff, not wasting their time and putting this so they come back. I know that they are very transparent and everything, but also like putting some work on this and bring it to the agenda, that's also like wasting their time. If we really want to tell them that, please, if there is any another purchases that will be from an organization or company that support Israel, then just don't do it. That's it. We already made a clear resolution, and we don't want to see those kind of items to come to us because all of us, we don't agree.
I think they hear it right now very
Yes.
clearly.
Yeah, and
Yeah.
I think part of the reason why some people landed on not wanting to do the purchases aspect of this is because we were, I don't want to like bring anything into existence, knock on wood, but I think maybe people expected a more insane reaction from the state of Iowa, and this would, in the purchases aspect, would be people were concerned that would be a harder thing to backtrack from if for some reason it became legally. But we have not seen that yet, so I'm agreeable to at some point in the future put a purchasing amendment on the resolution or however form that would take. So, but for right now,
Even we don't need to, as long as we council right now. We agree on that. We just direct the staff. We don't want this anymore in the agenda, and that's it. But I agree that if you want to put it on the resolution, thinking that we're gonna, like in the future, there is another council will come and they are not gonna value the same that things we value, maybe we can bring that. But also they can come up with another resolution against our resolution. That's what we see our presidents doing. So then we should just keep this right now clear to the staff.
Just for clarity, so the item that we noticed up for discussion today was a purchase of a Caterpillar trash compactor.
Yes.
And so it would not be appropriate for council to decide to make an amendment to its earlier Gaza resolution. That would have to be handled separately, just so we're clear.
Yes, we
Thank
are
you
not
for
doing that. I just like want to highlight clearly. We don't want those kind of items to come again. That's it.
All right. Any other thing on this? Any other comments by council?
No, we're ready to vote no.
All right. Roll call, please.
Sala?
No.
Teague?
No.
Wyline?
no.
Alter?
No.
Burgess?
No.
Mo?
No.
Motion passes 6-0.
It fails,
Fails.
6-0.
Fails.
Yeah.
6-0. All right. We are moving on to item number 9, which is community comment. This is an opportunity for folks to comment on anything that is not on our agenda. Public comment is intended so that members of the public can be heard by council because community comments for items not properly noticed on the agenda, council cannot engage in discussion or debate due to open meeting laws. And wanted to see the hands of those that would like to speak during this time. All right. You'll be allowed up to 3 minutes. There is a sign-in sheet, but there are also pages in the back that you can fill out and just drop in the basket. Welcome. Please state your name and city you're from. You'll be granted up to 3 minutes.
Good evening. My name is Morgan Sauce, and I am from Iowa City. Today, I would like to speak about the ongoing COVID-19 pandemic. Normally, I would start this with the Pandemic Mitigation Collaborative's estimate of actively infectious Iowans this week. Unfortunately, I can't. The government shutdown has left the CDC in a communications blackout with vital information for disease prevention left at the doorstep, while ICE and CBP continue to function unabated, terrorizing our communities of color. PMC's estimates, based off of last week's data, show 1 in 58 Iowans actively infectious with COVID. Last time I spoke in front of City Council, I mentioned a study from July 2025 by Colorado University that showed dormant cancer cells in the lungs rapidly duplicate during acute COVID and influenza infections. This leaves cancer patients and survivors at increased risk of remission and severe illness. 2 weeks ago, another study confirmed the worst suspicions. Released in Biomed Central on September 26th, scientists found that SARS-CoV-2 can contribute to tumorous cancer development. A short biology lesson to catch everyone up. Cancer is caused by cells with damaged DNA rapidly replicating. These damaged cells do not have the shutdown systems built into every cell called apoptosis, which is basically a cell's self-destruct button. SARS-CoV-2 damages the cell's ability to repair, correct, and maintain healthy DNA, and its ability to start apoptosis in the case of extreme damage. These damaged cells go on to reproduce unchecked and cause cancer, especially tumorous cancers. I will remind everyone that Iowa is the second highest in the nation for cancer rates per capita, long attributed to dumping fertilizers and radioactive runoff in our rivers. Now we can officially add rampant COVID spread to the equation. Some steps we can take to mitigate COVID spread at the local level are: 1, HEPA filters in every room in every public building and school. 2, mandatory COVID vaccinations for our city employees, school faculty, and children attending public schools in Iowa City with a carve-out for medical exemptions. 3, KN95 or better masks should be available in every public building in the city, mandatory for faculty in all healthcare settings, and mandatory for patients in hospitals and clinics with a carve-out for medical exemptions. As time goes on, our communities have been and will continue suffering and lose productivity because of repeated damage done to our bodies from COVID infections. Please stand up for your community and protect the health of yourselves and those whom you were elected to serve. Thank you.
Thank you. Welcome.
Thank you. My name is Mary Gravitt, and I'm a resident of Iowa City. And I'm here to talk about the Palestinians as they resemble the African Herero of Namibia, hopefully placed on the ballot box in November, to whom Imperial Germany's General Lothar von Trotha sent his clear message: get lost or die. All German methods of genocide used by the Palestinians and Netanyahu are copied directly from von Trotha's playbook: bullets, mass graves, water poisoning, expulsion to the desert, and death by hunger and thirst. This tragedy happened at the dawn of the 20th century. Thereby, Namibia was the blueprint for the Nazi Shoah or Holocaust. German Lieutenant General von Trotha signed the order with the full backing of the political system, as with Trump and the mainstream press and the press of the German Empire. Everything was done in cold blood and detailed planning, murderously efficient. With detailed planning, murderously efficiency. Von Trotha wrote in his journal, "I will wipe out rebellious tribes with rivers of blood and rivers of money," similar to Netanyahu's tirade against Gaza's civilian population. Only following this cleansing can something new emerge, he wrote in his diary, published in the German press in 2004, on the 100th anniversary of the Herero Holocaust. The spirit was delegated to his subordinates and reported to his superiors in Berlin, using biblical reference as Netanyahu and the IDF does, as a holy reference to destroy, slay, and exterminate, per Haman's word in the book of Esther. Accordingly to the report, Israel Haaretz stated the general orders his soldiers were to shoot above the heads and the children of the women and children and force them to flee. This was obviously cynical, as he allowed them to escape only to die in the desert. Anyone who tried to flee the desert was murdered. Look up this African genocide and compare it to the Gaza genocide. And furthermore, I'm bringing up the bus shelters again. After reading the memo on bus shelters, all I can say is we have had enough surveys. If you are lost, just follow the wooden benches that are already there. We have to stand our ground and
Thank you. Welcome.
Hi, folks. My name is Clara Reinen, and I live in Iowa City, Iowa. My public comment for tonight, I had written for Sean Harmson, for Councilor Harmson. He is, I'm not sure, I'm sure he has a very valid reason for not being here, like genuinely. But I'm a little nervous that if I don't give the comment tonight, I will be too nervous to give it next time. So I'm just going to read it as I wrote it, and I'm sure he will see it, or I can always email it to him as well. Sean, I want to remind you to consider the power that you hold as a city councilor who sits up at the table and has a place to speak. Last city council meeting I attended, you read the jail roster as supposed evidence for why we need to build a new massive jail. To remind you, that jail roster also includes pre-trial, non-convicted folks. It's common practice to overcharge when arrested and have folks plead down. For example, when I was arrested for an act of civil disobedience, I was charged with criminal mischief, resisting arrest, and disorderly conduct. I pled down to disorderly conduct and ultimately took deferred judgment, which is to say that if you had looked at my name on the roster the night I was arrested, it would show a drastically different picture than my criminal record today, which is empty because I took that deferred judgment. The act of reading a jail roster is dehumanizing and ultimately, frankly, caused harm to folks in the room. I don't know if this had crossed your mind before you made the comment, but many folks who were opposed to the joint facility have also been victims of violent crime, myself included. I was not mentally or emotionally ready to hear you read a list of violent actions that were allegedly perpetrated, and if I'm being honest, it was incredibly triggering for me. I hope you can take this comment not as a personal attack, but rather a reminder that you have immense power and privilege, and sometimes it's easy to forget what that means. So I would just like to remind you, Sean, and everyone that language is important, our language matters, and I would encourage you to just take a little bit of time to consider the impact that some of the language and tactics we're using to try to get certain measures to pass, just to remember the effect that that can have on folks in the room and who are reviewing the meetings later. Thanks.
Thank you. Anyone else would like to have a comment during this time? All right, welcome.
Hi, I'm Mike Anderson of Iowa City. I just wanted to talk briefly about ICE. I've just come here tonight to urge bold and decisive action by the Iowa City City Council to frustrate, slow, and impede at every turn possible the presence of ICE in this community. I know that I'm preaching to the choir to a certain extent to some people in this room, but on Thursday, September 25th, we all helplessly watched as ICE took violently a person from our community. And yeah, it's very upsetting. What wrong did this person do to warrant this treatment? Where has he been taken? What condition is he in now? What will happen to the loved ones he's been ripped away from? These are the kinds of questions we've all kind of gotten used to just asking, but not really expecting answers to in this time that we're in right now. I think an important question, of course, is what are we going to do about this as a community? I think we need more than inspiring speeches to push back against the lawlessness of ICE in our community. We need bold and decisive action, and I'm grateful to live in a community that took action that, you know, we all saw tonight with you guys on the vote with the Caterpillar trash compactor. It's honestly like, it's inspiring, and it's cool to see from the local leadership. And I know that our civic structures limit what you guys are all able to do in the face of all of this. But that doesn't mean you're entirely powerless. Just yesterday, Mayor Brandon Johnson in Chicago signed an executive order establishing ICE-free zones. The American Immigration Council has a paper that lists a range of other relevant municipal policies, including restricting cooperation of local police with ICE. So I just urge you all to consider these and any other measures that you all as capable and experienced policymakers can imagine that might hinder or halt the activities of ICE in our community. Will we be able to stop the next person from being taken? You know, maybe not, but I feel like we have to try. So that's it.
Thank you. I'm going to invite you to sign in there. please. Thank you. And with that, we will end our community comment section. We're going to move on to items number 10, planning and zoning matters. 10A, zoning code amendment, floodplain management standards. Ordinance amending Title 14 zoning related to the city's floodplain management standards to ensure the community's continued participation and eligibility in the National Flood Insurance Program. I'm going to open the public hearing and welcome.
Good evening, Mayor and Council. Danielle Sisman, Neighborhood and Development Services. The proposed ordinance tonight updates the Iowa City's floodplain management standards to adopt FEMA's new flood insurance rate maps, FIRMs, and the Flood Insurance Study, or FIS, and aligns our local zoning codes with the National Flood Insurance Program requirements. Iowa City participates in the National Flood Insurance Program, which makes federally backed flood insurance available for all eligible buildings, whether they are in a floodplain or not. Adoption by the effective date of the new maps in December of this year preserves major benefits for our residents and businesses, such as continued access to federally backed flood insurance and mortgages. So the actions that we need to ensure tonight are adoption of our new firm maps that are being published by the FEMA, and to align some changes in our local zoning ordinance. What's it mean to be participating in the NFIP? The NFIP provides federally backed flood insurance to property owners and businesses. In exchange for flood insurance, participating communities such as Iowa City must adopt and enforce minimum floodplain management regulations to reduce flood risk. The NFIP offers coverage for flood damage to homes, belongings, and businesses, and is, like I said, managed by FEMA. The firm, or that map, is the the rate map for that insurance. It's once effective, it's the official and current flood insurance rate map adopted by Iowa City, and it's used to determine the minimum floodplain management, building code, and flood insurance requirements under that program. FEMA provided us copies of that map in June, and they will, like I said, become effective in December. As a delegated community, Iowa City is responsible for locally enforcing those floodplain management regulations. We coordinate with the state and the Iowa DNR for guidance as needed. So this shows a side-by-side of the previous effective map and the pending preliminary firm that will be effective in December. In Iowa City, the Iowa River and its 5 tributaries, Clear Creek, Ralston Creek, Rapid Creek, Snyder Creek, and Willow Creek, transport water through their banks. Throughout the year, water overtops the banks and does spread out into those floodplain areas. The area of floodplain is greatest around the Iowa River, over 900 acres impacted, and includes nearly 300 structures. Along Ralston Creek, the floodplain is less than half that size, about 400 acres, but contains roughly 450 structures. As I said, in flood hazard areas, new buildings, additions, remodels require a floodplain development permit through the city. Flood heights along Ralston Creek have decreased if you compare these two maps side by side. It's a little hard to see, but just generally that Ralston Creek area has seen a decrease in that area. Some homes and businesses that were previously in a special flood hazard area and subject to mandatory flood insurance purchases requirements may no longer be. However, the flood heights along Willow Creek have increased somewhat, possibly putting some houses, structures into required flood insurance standards. In addition to participating in the NFIP program, the city also takes part in the Voluntary Community Rating System, or CRS program. This program recognizes communities that go above and beyond the NFIP's minimum standards by offering flood insurance premium discounts to residents and businesses. Our existing higher standards help Iowa City achieve credit points to stay at a higher class and simultaneously protect the community from flood hazard risk. The city of Iowa City currently holds a CRS class rating of 6, which delivers a 20% insurance premium discount citywide, reflecting our proactive risk reduction work as well as supporting sound floodplain management and community resilience. The proposed code updates clarify definitions, spell out what constitutes development, add standards for accessory structures, strengthen enforcement and no-rise flood requirements, reaffirm elevation and construction standards, formalize documentation, and provide tailored variance criteria. Together, these amendments reduce overall flood risk, help the city recover more quickly after flood events, and provide a predictable permitting framework, while preserving residents' access to insurance benefits and federally supported assistance. Staff did prepare the proposed ordinance in collaboration with the Iowa DNR, whose responsibility it is to make sure participating communities are enforcing the NFIP criteria. Overall, the adoption of the new flood insurance rate maps, flood insurance study, and the proposed amendments will ensure Iowa City continues to remain a participating community eligible for flood insurance within the NFIP. Staff did recommend adoption of the ordinance, and at their September 3rd meeting by a vote of 4-0, the Planning and Zoning Commission concurred with that staff recommendation. I'm happy to answer questions.
Great.
Danielle, I don't know if you know why, but do you know why Ralston Creek would be flooding less? That doesn't seem right.
It may not be flooding less. It may just be that those maps were inaccurate when they were studied in 2007.
Okay.
FEMA continually refines their ability to estimate the impact of flooding. There's also development differences in those corridors, so it just depends on a lot of factors, but generally FEMA just gets better at estimating and uses better data in their studies and then refines their estimates. So it doesn't reflect a change in policy or necessarily change in rainfall, although it may be. That's part of the continuing analysis that they do.
Okay, thank you.
I apologize for this because you may have said it already. When did FEMA do this work? Because as we know, recently, FEMA has had some issues.
We were anticipating this actually several years ago. They started this process several years ago. They have a process just like we do for many of these kind of code changes where they advertise them to the public. They take comment back from a variety of stakeholders. Some of the comments they got in the first round of that review pointed out some inaccuracies in their estimates and their data, so they had to go back through that process. So several years ago, we actually put everybody in notice in the community that these maps are going to be coming out soon, and it's taken a couple more years.
Okay, no, that's great, and I realize.
Sure.
I'm going to leave it at that. Thank you.
If I remember correctly, after the Tennessee floods, there was a lot of problems because people in some of those communities did not have approved FEMA flood maps, which means they didn't have insurance and they couldn't get FEMA recovery. Is that how that works? Like, we need these maps so people can both get insurance and get FEMA recovery if there is a disastrous flood?
To be eligible for FEMA money, you have to participate in this program.
Yeah. So the reasons for not participating are pretty poor.
I mean, if we did not participate in this, we would lose quite a few of the benefits we currently have, not just that 20% insurance premium discount. It would make us ineligible for FEMA recovery money. That's actually.
And we adopt these maps, but if a developer or a community member wants to modify these maps, there's a process for that too, right?
There absolutely is. After the maps are adopted, someone can study their individual property more specifically, hire an engineer, go through a process through FEMA called Letter of Map Revision. So they take that map and they take their study and they say, I think this part of the map needs to be revised. FEMA has a review of that, whether they choose to accept that request or not, and then they keep that on file as well. So.
Yeah, that can sometimes make those maps change a lot over the time. It's private people saying nope. So, thank you.
Hearing no more questions, thank you. Anyone from the public like to address this topic? If you're online, please raise your virtual hand. Seeing no one in person or online, I'm going to close the public. Wait, before I close the public hearing, I want to see if folks are inclined to vote with P&Z. All right. I'm going to close the public hearing. Could I get a motion to give first consideration, please?
So moved. Alter.
Second, Mo.
All right, council discussion.
I think we absolutely should do this.
How does it affect our new bird-friendly status?
Yeah.
I'm a bird enjoyer. I just want to,
Roll call,
I don't want an
please.
actual answer, Jeff. I'm sorry.
Roll call, please.
Teague.
Yes.
Wyline.
Yes.
Alter.
Yes.
Burgess.
Yes.
Mo.
Yes.
Sala.
Yes.
Motion passes 6-0. Item number, we're going to move on to our items number 11, regular formal agenda. 11A is Urban Renewal Plan Amendment, Resolution approving Amendment number 18 to the City University Project 1 Urban Renewal Plan to add projects to the urban renewal area. I'm going to open the public hearing and welcome Rachel. Yes.
Hi, Mayor and City Council, Rachel Kilberg, Economic Development Coordinator. So state code requires that any urban renewal activities that occur in an area or projects that occur in an area must be amended into that urban renewal plan. This particular amendment is for our City University Project 1 urban renewal area, which covers our downtown and riverfront crossings area. And This particular area has been amended 17 times prior. Most of those have been to amend projects into the urban renewal area. So this is the 18th amendment, and I just want to note that by approving this amendment, you're not necessarily approving the projects that, or I shouldn't say not necessarily, you are not approving the projects that we're adding to the plan. It's just affording you the opportunity to use TIF funding to help support the projects, and that would all come to you at a later city council meeting. So the two projects being added to the plan are the interior renovation of the historic senior center building. Amendment 17 added the exterior rehabilitation project for the senior center. The interior project will include accessibility improvements, building code, architectural and cosmetic work, wayfinding signage, upgrades to mechanical and electrical systems, and then sustainability and energy efficiency upgrades. And then the second project being amended into this urban renewal plan is a downtown building, a downtown building and facade grant program. So this will be targeted at helping buildings to make facade improvements, reactivate underutilized space for interior build out, again, energy efficiency and accessibility improvements. So again, state code requires or lays out the process that is needed to amend an urban renewal plan, and all of those steps have been completed. At your September 16th City Council meeting, you passed a resolution of necessity and set that public hearing. On September 15th, a consultation with the affected taxing entities was planned and held. We received no attendees or comments on our plan amendment, and then the public hearing notice was posted. Any questions?
Can you speak just a little bit about the building and facade grant program? What's the maximum amount per eligible building?
Sure. So it was just launched today, and there's two funding tiers to the program. So the first funding tier, I believe, is $10,000 to $50,000 grant award. It's a 50-50 matching grant, so that would require a total project cost up to $100,000. There's no minimum project cost if the scope is limited to accessibility or energy efficiency improvements, so really trying to encourage those types of improvements. And then the second funding tier allows that grant award to go up to $100,000. So for a $200,000 project cost, if energy efficiency is included in the scope. So again, just trying to prioritize those larger and more meaningful energy efficiency projects in addition to maybe others that would be included in the project scope.
And historic preservation gets
That's correct.
special. Yeah. Thanks.
Thank you.
All right. Anyone from the public like to address this topic? If you're online, please raise your virtual hand. Seeing no one in person or online, I'm going to close the public hearing. Could I get a motion to give for approval, please?
So moved, Mo.
Second, Burgess.
All right, council discussion.
I just like that there is movement for continued improvements for the senior center in particular, as well as, making sure that facades and interiors can be kept up in downtown.
Roll call, please.
Wyline?
Yes.
Alter?
Yes.
Burgess?
Yes.
Mo?
Yes.
Sala?
Yes.
Teague?
Yes, motion passes 6-0. Item number 11B, real estate purchase, 1616, 1618, 1620, Aspen Court, North Liberty Resolution approving a purchase agreement for 1616, 1618, and 1620 Aspen Court, North Liberty. Can I get a motion to approve, please?
So moved, Mo.
Second, Alter.
All right, and welcome Tracy Heishu.
Thank you, Mayor. I'm happy to discuss a recent funding opportunity made available to us through the Housing Trust Fund of Johnson County. In 2023, the City of North Liberty contributed a portion of their ARPA funds to the Housing Trust Fund so that they could create affordable housing within their community. As many of you know, the Housing Authority is a city division, but we operate as an enterprise fund. So all the money that it takes to operate the Housing Authority comes from generated rent revenues and federal funds through the Housing Choice Voucher Program and the public housing programs. Our housing jurisdiction, though, includes all of Johnson County, Iowa, and parts of Washington County. And as we serve the entire county, we're able to apply for these funds. We currently have about 220 voucher holders in North Liberty, but yet all the housing units that we own and manage, about 123, are in Iowa City. This opportunity allows us to better serve residents throughout our whole jurisdiction to strengthen access to housing where people live and work. We've identified 3 properties you see on the screen. They are 3-bedroom townhomes on Aspen Court, North Liberty. They are new construction, so we anticipate maintenance needs to be low for the first 5 to 10 years. The total cost is $927,500. We secured a $368,000 forgivable loan through the Housing Trust Fund of Johnson County. The remainder of the funds will be paid through our available affordable housing, Housing Authority available balances. On the agenda, you saw that there's an agreement for 2 of the units since their Housing Trust Fund is contributing $368,000. We will limit at initial lease up to people below 50% of median income. We anticipate all vouchers being utilized at least exclusively for the first 5 years. But since we're using vouchers, basically everybody, all 3 units, will have to be under 50% of median income upon lease up. We did look at, if you remember, when Naomi presented about opportunity zones, basically that means it's low social vulnerability and then a higher economic mobility for children of households with lower incomes. You can see the project location. We are in basically a high opportunity area. We followed the selection criteria that we set up by council a few years back regarding amenities. It's not in the floodplain, items like that. Follows all of our site selection criteria except for it's not in Iowa City. But since this is North Liberty funds, it can't be. So we have a purchase offer on this. As soon as, if you guys approve it, we'll enter that. We'll enter the affordable housing agreement with the Housing Trust Fund. It is a 40-year compliance period. That means if for some reason in year 20, our priorities change, anything happened, we could sell it, but we'd have to get permission through the Housing Trust Fund. But you know, when the Housing Authority owns and manages property, we consider that permanent affordability. So even if we sold it, we'd invest that back into the community. But for 40 years, if we sell it, we'd have to return those funds back to the Housing Authority, or sorry, the Housing Trust Fund. Too many housing words with housing in it. So, and I know Ellen from the Housing Trust Fund is here tonight if you have any questions. And I'd be happy to ask it or answer anything else that you might have.
I do have, I just had one question, and it's back, I don't know, probably about a third of the way into you talking about this. With those units, you said you anticipated something about voucher use for 5 years. Can you explain that a
Due to the
little bit
source
more?
of funding, they'll have to be project-based vouchers. We anticipate using vouchers, but we'll get the minimum, we'll look for the shortest period that we can to be in the project-based voucher program. And then after 5 years, that being said, we own, besides the public housing units, we own 23 other city owned affordable housing. All but one have a voucher. So we fully anticipate that a voucher will be living in these homes for the entire tenure that we own them.
Okay.
I think my question also just kind of the same line. I understand what you're saying, but this is now considered public housing owned by the city of Iowa City. But because now we are on that like kind of stage where our public housing will be like we receive some voucher for the people who have Section 8 to live on it, right?
It's not public housing. It will not be it's city-owned affordable housing. That we own it and we'll manage as affordable housing and we'll use our vouchers.
Is this like the one that we own, like in the Peninsula and the like somewhere? Yeah, okay.
Like the 3 condos that we bought
The
on
3
Herbert Hoover.
condos also on the.
It'll be
I
operated
see.
as affordable housing as long as we own it, but it's not part of the public housing program.
Yeah, and it just will add to the affordable housing that people use Section 8 can use it.
Yes.
Okay, thank you.
Any other questions?
No, this is great.
All right.
Yeah.
Housing Trust Fund is in the building. Anyone have any questions for her?
Thank you for the
All
opportunity.
right, great. We're going to move on to questions or comments from anyone from the public at this time. Seeing no one in person or online. Council discussion.
Good.
It's really
amazing.
exciting.
Really cool.
It is.
Thanks to the staff for always being creative and seeking opportunities.
Yes,
Three
absolutely.
down affordable housing from the goal. I don't know how much is the goal. 3 down.
And these were also, sorry, this is a rhetorical question, not to be answered by staff since we're in discussion. But these were all 3-bedroom units?
Yeah.
So three bedroom?
Yes.
Awesome.
Very good. Yeah, this is really cool. I think some people might be confused why we have authority about what gets bought and done in North Liberty. So, because I was confused when I came on council first, but our housing authority covers North
Also
Liberty and Coralville as well, and University Heights. Is that it?
Everywhere, Johnson County and Washington County. Johnson County
Makes
and
total
Washington
sense.
County,
Yeah.
yeah.
Almost all of our vouchers are in Johnson County, but yes, all of Johnson County with
Yes.
a sprinkling of vouchers in the other two.
Okay, yeah, so
Yeah.
that's why we're doing this, but yeah, it's really cool.
Yeah, it's very cool, and I think it's like good to have in another even community like this one. Thank you.
Roll call, please.
Alter,
Yes.
Burgess,
Yes.
Mo,
Yes.
Sala,
Yes.
Teague,
Yes.
Wyline.
Yes.
Motion passes 6-0. Item number 12 is council appointments. 12A is civil service commissions, one vacancy to fill a new member upon appointment through April 4th, 2027. And council discussion.
I would nominate Mark Fay.
Okay, there was only one.
Yeah.
All right, all in favor, say aye to that nomination.
Sorry, we need a motion in a second.
I would.
Okay,
I move to nominate.
I move to nominate Mark Fay.
I second.
all right. Moved by Mo, seconded by Salah. All in favor, say aye.
Aye.
Any opposed? Motion passes 6-0. Item 13, announcements of vacancy previous. 13A, Airport Zoning Board of Adjustment, one vacancy to fill a 5-year term. Board of Appeals, one vacancy to fill a one vacancy for a licensed electrician to fill a 5-year term. Climate Action Commission, 3 vacancies to fill 3-year terms. Human Rights Commission, 3 vacancies to fill 3-year terms. Parks and Recreation Commission, 3 vacancies to fill 4-year terms. Public Art Advisory Committee, 1 vacancy to fill for an at-large representative and a 3-year term. Public Art Advisory Committee, 1 vacancy for an art or design professional to fill a 3-year term. Senior Center Commission, 2 vacancies to fill 3-year terms. Applications must be received by 5 p.m. Tuesday, October 28th, 2025. Housing and Community Development Commission, 1 vacancy to fill an unexpired term. Applications must be received by 5 p.m. Tuesday, October 14th, 2025. Airport Zoning Board of Adjustment, 1 vacancy to fill a 5-year term. Airport Zoning Commission, 1 vacancy to fill a 6-year term. Board of Appeals, 1 vacancy to fill a HVAC professional to fill an unexpired term. Historic Preservation Commission, 1 vacancy for Brown Street representative to fill a 3-year term. Historic Preservation Commission, 1 vacancy for Jefferson Street for a representative to fill a 3-year term. Historic Preservation Commission, 1 vacancy for Woodlawn Avenue and a representative to fill a 3-year term. Vacancies will remain open until filled. And we are moving on to item
Wait, I have a question about
number 14. And we'll talk to you after because we're still in our agenda at this time, but we'll come and talk to you after.
Okay.
Thank you. All right, we're at item number 14, City Council information.
The free medical clinic has their ribbon cutting tomorrow.
Right?
Yes.
Yes.
Is it tomorrow, really?
Yeah, Thursday.
Oh.
No, it's
Wednesday.
Thursday.
Is it Thursday?
Oh, no, it's Wednesday.
Wednesday,
It's tomorrow. It's tomorrow, yeah. And then I also wanted to do a shout out to, there's a child care summit going to be held at Big Grove on October 14th, 3:30 to 6:30. It should be interesting, a lot of different people who are going to be convening and talking about local child care solutions. And I get to be on one of the panels.
I think we had a very amazing, nice African festival. So the people who did not come, they miss a lot.
Yes.
It's true. Yeah.
A lot of arts and culture and great food.
I just wanted to bring up that I think a lot of people, I've been trying to answer this individually as much as I can, but I feel it should make it just kind of like public record so anybody can refer to it. Most recently, Jorge Gonzalez is still in the Lynn County Jail. People were asking about his whereabouts and his situation, receiving counsel, probably going to be in Iowa for be incarcerated in Iowa for a long haul fight is how it was described to me. So if community members were looking for an update on that, that is the information I have right now. So,
Can you say where you got that information?
public information
Okay, so
and through
not through a grapevine.
community organizations, and followed up with public information to make sure that it was accurate. I also wanted to say shout out to the Scouts for sticking the whole meeting. So yeah.
Great. Any other comments? All right, we're going to move on to item number 15, which is reports from our city staff, city manager's office,
Nothing tonight?
city attorneys.
Nothing for me, thank you.
All right, and our city clerk. All right. Item number 16, could I get a motion to adjourn, please?
So move, Burgess.
Moved by Burgess, seconded.
You did not get back to her?
I'll have to talk to her after because we're still following our agenda.
Oh, I see
Yes.
there is some area where you can
No.
public comment again.
No. Moved by Burgess, seconded by
Wyline?
Wyline. All in favor say aye.
Aye.
Any opposed? Motion passes 6-0. We are adjourned.